Father. Give us civility, give us understanding, give us what we need in order for us to make our community a safe place. God, we ask you to touch the individuals in the lives that's been stricken by the coronavirus, dear Heavenly Father. We pray for the Goodrow family, dear Heavenly Father, Commissioner Servia's stepdad. And dear Heavenly Father, we also ask you right now in the name of Jesus to give strength right now to the family of Gary Tibbetts. We pray for Miss Valerie. We pray for our Congressman Buchanan and his staff and everyone in which the lives have been touched by the service of Gary Tibbetts, dear Heavenly Father. We ask you to touch our community, dear Heavenly Father. Strengthen us in our moments of grieving, dear Heavenly Father, for that was such an individual of service, dear Heavenly Father. We thank you for his life. We thank you for his legacy. But more than anything, dear Heavenly Father, as we carry on, we ask you to guide us in the right direction from which you would have for us to go and strengthen us throughout the course of this meeting, dear Heavenly Father. In Jesus' name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty. Okay, we're going to go ahead and at this point turn it over to the county attorney who's going to introduce the subject, and then we're going to hear from staff. So,
good afternoon, Madam Chair. For the record, I am Bill Clegg, Chief Assistant County Attorney, and this is a county attorney item. Last Wednesday, the board directed our office to prepare it and bring it back to you today. The agenda item includes a draft resolution and supporting materials to impose a mandatory face covering requirement in Manatee County. As I've stated now a few times, our office does not advocate for or against policy decisions like this one. But once we are directed by the board to put something together, it is our job to bring it back to you and also to advise you of the best way to go through the decision-making process to make it legally defensible, assuming that the board does decide to adopt the resolution. And with that in mind, we do have a recommended order of discussion. I would like to turn it over first to County Administrator Courier and Director Sauer just to briefly summarize the reports that you received last Wednesday on COVID-19. And then the Manatee County Health Department Director, Dr. Bensi, is here to address the medical science issues regarding the transmission of COVID-19. And then after that, I will walk the board section by section through the draft resolution, hopefully answering some of the questions that you and others may have up front about it, and then we can deliberate and go to public comment. So, Madam Chair, without any objection, I would recommend that you now turn the discussion over to County Administrator Courier.
okay, thank you. Sherry?
Madam Chairman, would you like an order for the public for Mr. Osborne to go through the ability for the public to tune in and participate in the meeting?
Yes, and actually, before we do that, I am going to read the Pledge of Civility. I wasn't sure when I'd read that, but before we start any discussion of public comment, I just want to make sure that everyone knows that this board has adopted a Pledge of Civility. It's one that we, as board members, have to live up to, and it's one we hope that folks, when they speak to us in these proceedings, will live up to also. It states, "We may disagree, but we will be respectful of one another. We will direct all comments to issues. We will avoid personal attacks." So just wanted to remind everyone that that is what we have adopted. Go ahead, John, and talk about how people can participate in this meeting.
Thank you, Madam Chair. I'm John Osborne. I'm a Deputy County Administrator for Manatee County Government. And I'll serve as the moderator today for public comment for calling in via Zoom for people to call into the County Commission meeting today and provide public comment. To be very clear, Commissioner Benak is the chair of the meeting today, and I'll be taking direction from her. I will be following her lead and assisting her to ensure that the public using Zoom or call-in by telephone will get to provide comments today that are clearly heard. So when the time comes for the public to address the board via public comment, Commissioner Benak will ask for members of the public present here in the Civic Center to come forward and address the board. And then she'll ask for members of the public calling in if they would like to be heard. So if members of the public that are not here today and are interested in calling in and providing public comment via telephone, the public can provide live comments via Zoom, via your personal computer, via tablet or smartphone, or its regular old telephone by calling this number. And the number is 1-888-788-0099. Again, 888-788-0099. That's a toll-free number. And there's a meeting ID you need to enter in. And it's a little bit of a long number, so I'll do it twice. 869-7082. 7338. Again, that number is 869-7082-7338. If you miss any of that, it's also at mymanatee.org under Government and Agendas. You can actually search it on our website to find the agenda today. It's pretty self-explanatory. Once you get to our county webpage of www.mymanatee.org, you can find the agenda, and all this information I just went through will be on that agenda format as well. So this will get you queued up for public comment. And once the commissioners are ready for public comment, I'll be providing some additional direction at that point to get you queued up so you could then present your comments to the Board of County Commissioners. Commissioner Benak, back to you.
Okay, well, at this point, I'm going to turn over to Sherry. She's going to do a little summary of where we are.
Thank you, Madam Chairman, members of the board. Very briefly, in order to just reiterate the action of the board last week in asking staff to work with the county attorney's office to bring this meeting about, we'd like to ask for one slide to be put up just so that everyone can see that three benchmarks that Manatee County has been tracking and responsible for tracking throughout this particular issue and this pandemic is in the following order. They're up on the screen: syndromic surveillance, epidemiology and outbreak decline, and healthcare capability. So this is last week's slide, and I just want to point out to the board, when we moved into today's meeting, there's a couple updates. Dr. Jennifer Bency is here, and in most of what she's going to be speaking, she'll be able to answer any current up-to-date questions on the influenza-like illnesses and COVID-like illnesses. But on the second one, the epidemiology and outbreak decline, when we were here last week, Manatee County was at 10.2%, and the state was at 12.5% of positive tests as a percent total. As we sit here today, yesterday, Manatee County's percent was 10.6, and the state was 12.5. So those have changed. They have advanced a little bit. Under the healthcare capability, the capability to treat all patients without triggering surge capacity, we've been providing the board with the hospital capacities updated based on the Department of Public Safety staff pulling together those numbers and working in collaboration with your three hospitals. And for the last week and a half, we have been tracking at very little, if any, additional capacity with staffing. We have tapped into the state resources for some additional staffing where needed, and some of the hospitals have received that. But at this point, right now, there is no additional capacity. There are some facilities outside of this area that can be accessed, if appropriate, by those three hospitals. Under the robust testing program, last week when we were here, we were at 16%, and as we sit here today, we are at 18% of the total population tested. I'm finished with that, and I'll turn it over to Director Sauer.
Good afternoon, Madam Chair, Commissioners. Jake Sauer for the record, Public Safety Director. My presentation that was given to you on Wednesday is attached in the agenda for your review. There is no significant changes to that presentation other than statistics that Dr. Bency is going to review with her staff, Dr. Hernandez. And the three of us are here to answer any questions you may have. I do have the latest hospital statistics report put out this morning by my team, the Manatee County Emergency Management and EMS, should you need that.
I would like to hear that. I would like to hear the latest.
Okay,
if you would let us know, as long as we have information, might as well get it.
okay. Would you like that now?
Yes.
Okay. For Blake, they reported this morning 0 beds available, non-ICU. They have a total of 260 patients in-house, 0 ICU beds available with staffing. They do have 12 ventilators, and 11 are in use. There's 58 total COVID-19 positive patients within the hospital. For Lakewood Ranch, they have 6 available non-ICU beds available with staff. They have a total of 84 patients in-house. They have 3 ICU beds available with staffing, 5 vents available, with 2 of those in use. And then lastly, for Manatee Memorial, they have 9 total beds, non-ICU available in the hospital, 263 patients in-house, 3 ICU beds available, and 18 vents available with 11 in use. And it's just important to remember, Dr. Bency, myself, and our emergency management team met with the director of Florida Department of Emergency Management yesterday on Sunday. We have requested additional vents, and those are going to be sent early this week, either this afternoon or tomorrow, for public safety to disperse out to hospitals as they need. And we've discussed alternate care sites should we need those with the state.
I'm going to just follow up, and then I'll ask Carol. There had been a request last week for additional resources to the state. Have those been provided?
Yes, ma'am. So there is 3 mission requests currently in the Florida Department of Emergency Management. All 3 have been received, and they're about 95% filled. Both Blake, Lakewood Ranch, and Manatee Memorial are receiving additional ICU nurses, regular care nurses, respiratory therapists as well. And as they come into the hospital system, they have to be orientated to each hospital's orientation system, and then they should be up and running later this week.
And that is a request to the state that the state is providing?
Yes, ma'am. That is correct.
Carol?
I just want you to make it clear for the public, when we're saying staff available, if I'm correct, that what we're seeing is like one of the hospitals, I think you said Blake has no beds available, and that's because he doesn't have enough staff to cover those extra beds that may be in the hospital, correct?
That's correct. So the ACA staffing report
Right.
is total beds. We collect data with the available staffing. So that's why all 3 hospitals have requested additional staffing through the Florida Department of Emergency Management.
And you mentioned vents open, because I know other floors, some of the floors can convert to vents once we have the vents. But what I was wondering, the state is providing the staffing, and I know last week you gave us a report of how many RNs, LPNs, respiratory therapists all the hospitals reported. So the state will let us keep those as long as we need to, and I think the federal government just gave 3,000 more staff to the state. Last week it was 1,000.
The current agreement with the Florida Department of Emergency Management is to cover that additional staffing for 2 weeks, and then the hospitals would be responsible for recovering the additional staff after that. Obviously, things change, and if there's a greater need, the state would relook at how long that they can assist the hospitals with that additional staffing.
And I apologize for messing it up, but I know the antiviral, Risamplicir, and also that has come down from the federal government to the state of Florida, correct? And are our hospitals being provided? I know we got a shipment in last week. Are we having an issue with that?
We have had that in the past. We do not have that current issue right now. I'm sure Dr. Bency's team and herself can further elaborate on that. But remdesivir does become available throughout the week, and it's in a just as need supply chain.
And one other thing about the palliative plasma, I know the blood bank supplies that. I've been posting that on my social media because I know there's a need. And when Dr. Bensi gives her presentation, could you please discuss that and update us on the status of that? Thank you.
Okay, I'm going to turn it back over to Sherry. I don't know if you're done.
I think we're ready for Dr. Bensi at this time, Madam Chairman.
Okay. Dr. Bensi?
Great.
Have you here?
Thank you so much. Good afternoon, Madam Chair, Commissioners, County Leadership. Thank you for having us today. If we briefly go over some of the other statistics for today in terms of case counts and other detailed information. So far today, we've identified 77,896 cases in the county. We've continually ranked 11th out of the 67 counties in terms of number of cases, although our population ranks 15th out of the 67. We have tested, as was said, approximately 75,000 individuals in our community, or a little over 18% of the population. Today, our positivity rate is running about 11%. Unfortunately, in terms of deaths in the county, we are at 156, including a dear friend of ours who we lost last week. 92 of those persons also were patients in long-term care facilities. Our cases of staff and residents are increasing again in these long-term care facilities. As you just heard, our 3 hospitals in the county have had to request nurses and other healthcare providers, actually 150 of them, as well as ventilators from the state to assist with the situation. EMS has been responding to COVID calls, which takes them more time because they have to put on extra gear or PPE, personal protective equipment, to respond to those potential COVID cases. Regarding children under age 18, there are 875 with COVID in the county, and this increased from 13.3 last week to 13.9 this week in the county. Those who have recovered from the virus is 5,743 individuals in the community, and for that, we are very grateful. If we look at our ranking of 11th in terms of cases versus 15th in the state in population, those counties that have more individuals than us but less cases include Pasco, Seminole, Brevard, and Volusia. Interestingly, these are the counties we compare ourselves to in public health due to similar demographics. What is the main difference between us and them at this point? Masks. If you could open up the packet that I have provided you, there is a document from the University of California, San Francisco that was put out last week that I believe simplifies the issue of masks, and I'd like to go through that with you. Early on, there was confusion about masks, but now both the CDC, the Centers for Disease Control and Prevention, and the World Health Organization now recommend masks for the general public. But earlier in the pandemic, both organizations recommended the opposite. What happened? Well, now the evidence is clear that masks help to prevent the spread of COVID-19, and the more people wearing masks, the better. The original CDC guidance was based on what was thought to be low disease prevalence early in the pandemic. So preaching that the juice isn't really worth the squeeze to have the whole population wear masks in the beginning, but was really a reflection of not having enough testing done. And we were in that position with not enough testing early on. It gave a false sense of security. As the CDC says, we should have never told people not to wear masks right off the bat. What may have finally convinced the CDC to change its guidance in favor of masks were rising disease prevalence and a clear understanding that both pre-symptomatic and asymptomatic transmission are possible and even common. Studies have found that viral load peaks in the days before symptoms begin, and that speaking is enough to expel the virus carrying droplets. And I'll explain more of this in detail. So the biggest issue here is that you can look at a crowd and you can't say this person has the disease and this person doesn't. So therefore, everyone should be wearing a mask. So what is the evidence behind this? One theory comes from laboratory studies of respiratory droplets and the ability of various masks to block them. And you have a picture on the screen demonstrating that. Another study of people who had the common cold or influenza found that wearing a surgical mask significantly reduced the amount of these respiratory viruses emitted in droplets and aerosols as well. So again, COVID is a new virus, 5 to 6 months old in our community. We know a little bit more about the cold and the flu. All right. A recent study published in Health Affairs compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found that mask mandates led to a slowdown in daily COVID-19 growth rates, which became more apparent over time. The first 5 days after a mandate, the daily growth rate slowed by 0.9 percentage points compared to the 5 days prior to the mandate. At 3 weeks' time, the daily growth rate had slowed by 2 percentage points. That's very important as we send our children back to school. 2 compelling reports suggest that masks can prevent transmission even in high-risk scenarios. For example, in one case, a man flew from China to Toronto and subsequently tested positive for COVID-19. He had a dry cough and wore a mask on the flight, and all 25 people closest to him on the flight tested negative for COVID-19. In another case, in late May, 2 hairstylists in Missouri had close contact with 140 clients while sick with COVID-19. Everyone wore a mask, and none of the clients tested positive. So the question is, do masks protect the people wearing them or the people around them? There's enough evidence to say at this point that the best benefit is for the people who have COVID to protect them from giving it to other people, but now we're still seeing a benefit from wearing the mask even if you don't have COVID yourself. Masks prevent the spread of the droplets from evaporating into smaller droplets that can travel even further. Another factor to remember is that you can still catch the virus through your membranes in your eyes. So it's important that both people are wearing a mask and not just one. If you look at the data regarding how many people need to wear a mask in a community, ideally we would want 100% of people to wear masks. But they say even at 80%, the population wearing a mask would do more to reduce COVID than a strict lockdown. The latest forecast from the Institute of Health Metrics and Evaluation suggests that 33,000 deaths could be avoided by October 1st if 95% of people wore masks in public. Does the type of mask matter? There are various masks out there. Comfort is extremely important. Some, like N95 respirators, are only necessary in medical situations. The bottom line is that any mask that covers the nose and mouth will be of benefit. The concept is risk. There's never 100% guarantee, but we're dramatically decreasing the risk, again, if you look at the slide. So if we're practicing social distancing, do we still need to wear a mask? There's 3 W's to ward off COVID-19: wearing a mask, washing your hands, and watching your distance. But of the 3, the most important is wearing a mask. We want to decrease the transmission of the droplets. On the next page, there's another presentation by a physician in the country, infectious disease expert, and she talks about what does it mean to be asymptomatic. I mentioned that term earlier. The virus COVID-19 can produce a range of clinical manifestations. Some people who are infected never develop any symptoms. These patients are considered true asymptomatic cases. When people do get sick from coronavirus, it takes on average 5 days and as many as 2 weeks to develop symptoms that can range from very mild to extremely dangerous. The time between initial infection and the first symptoms is called the pre-symptomatic phase. So how many people are asymptomatic? Estimates of the proportion of true asymptomatic cases, those again who are infected and never develop symptoms, can range from 18 to 80%. Huge at this point as we still look at the studies and gather more data. However, the most accurate way to determine the rate of asymptomatic cases is to test people, regardless of whether or not they have symptoms. And that's what we're doing a very good job of in Manatee County. Though none of the studies are perfect, a lot of evidence supports a true asymptomatic rate of around 40%, plus some additional fraction of patients who are pre-symptomatic. Today in Manatee County, we have estimated it to be 48% of our cases were asymptomatic. 48%. How can asymptomatic people spread the virus? Compared to most other viral infections, coronavirus usually produces a high level of viral particles in the upper respiratory tract, specifically the nose and the mouth. When those viral particles escape into the environment, this is called viral shedding. Researchers have found that pre-symptomatic people shed the virus at an extremely high rate, similar to the seasonal flu. But people with the flu don't normally shed virus until they have symptoms. The location of the shedding is also important. The virus that causes the SARS epidemic in 2003 did not shed very much because it wasn't in the nose and the mouth, it was deep in the lungs. Since COVID-19 is present in high numbers in a person's nose and mouth, this virus then is much easier to escape into the environment. When people cough, talk, sneeze, they spray droplets of saliva and mucus into the air. Since COVID-19 sheds so heavily in the nose and mouth, these droplets are likely how people without symptoms are spreading the virus. I'll stop there.
Okay, questions? Carol?
Dr. Bensi, first of all, the plasma question I asked, the convalescent plasma, can you tell me how we're doing in Manatee County? And you represent Sarasota, Manatee, DeSoto?
Just manage.
Just Manatee, sorry. Okay, how is have you heard how our supply is?
I know that the blood banks are providing incentives for people who have previously tested positive and have now tested negative for the virus, are encouraged to provide plasma. There's a big campaign, but I don't have the exact numbers.
And I thought you said over 800 children in Manatee County are positive for COVID. Now, probably the majority of those may not have symptoms or require acute care, but when they do, they aren't staying here, right? Because we don't have we have pediatrics in some of the hospitals, but usually kids go to All Children's or Johns Hopkins, it's called now, correct?
Correct.
Is that what's happening?
Yes. In children, we're seeing more of the asymptomatic cases than in adults. So they are the ones who can spread the virus. So these are the number of positive cases. Fortunately, we have not had any deaths in children. In the county, unfortunately, we are seeing that, though, occurring throughout the state.
And I know you do tracing, so I'm going to ask this question. When you have positive children in the homes, are you seeing positive family members? Have you noticed that trend?
I'm going to ask Dr. Hernandez to speak about that issue since he's been interacting.
They all say, well, kids will get it and they're fine, but, it's the parents and the family members.
Yes, what we have found through contact tracing is that most children, they are get the virus from a sibling or pass it to siblings in the household.
Okay.
So far.
So they're passing it to other kids and not their parents, grandparents?
To the parents and grandparents. We have many cases of those that have infected grandparents and people that have high risk comorbidity in the household, like diabetes, obesity in the house.
And two other questions about contact tracing, and I know at one point when this all started in March, we were really trying to do that. National Guard came down and they were helping. Can you tell us how we're doing in contact tracing in Manatee County?
Yes, each positive case that we got through our system generates an average of 10 to 15 contacts. So what we're doing, we are following up on each contact to ensure that we know how the virus is being spread, what's the comorbidity around those people that were exposed, and delineate a plan of isolation is needed.
Okay, and as far as coding, we're seeing this all over, they're usually tagging us in all their social media. But the coding of the COVID codes versus other codes, I'm hearing that, I'm telling you what I'm hearing, but I know working on my other job that I see all that. It would be negligence if you didn't add that the patient had COVID when the patient's in the hospital. But can you explain when a patient comes in, no matter what they come from, explain that every patient has different, like high blood pressure, diabetes, and all those are codes, including COVID. Can you explain that? Because a lot of people are thinking that everybody's cooking the books and everybody that comes in and out of hospitals is COVID positive, and that's 100% not correct. I used to help my husband do billing in his office, but I would prefer to hear from the experts.
Yes, ma'am. Absolutely. When patients are being assessed within a medical office or in the ER, we collect all the information of the comorbidity of that client. So we look at illnesses like diabetes, obesity, hypertension, coronary illnesses, and that information is taken into consideration because it will definitely impact the outcome of the infection moving down the road. So it's of vital importance to make sure that all the information is recorded properly and is collected in a way that can assess everyone looking down the road through the epidemiology team and also the contact tracing. All that information is really vital for that.
And we hear that people just mark COVID because you get paid more with the diagnosis code. Is it not true that when a patient comes in, and I don't know if this is reported in the numbers, but when a patient comes in, until they test positive, there is a diagnosis code for pending, and then once that they are, but they're also separated, and I don't know if that's in your numbers, Jay, but I have a friend that was held last night until because they don't know if she's positive yet, but her x-ray showed that she had the glassing in her lungs, and she came in for a heart issue, and she's like in her 50s. So do you know, or I know there's doctors here that know that, but I mean that work out in the field. I don't know, do you know that if there's a diagnosis code for pending results and COVID?
Not certain if there's one for pending, but definitely there's different codes under COVID that includes the comorbidity of all the conditions associated with it.
And if any doctors speak today, they may know. I know in my job, my regional director told me in home health that when we look at the chart, there are when they're pending versus when they're positive. We still have to do the same PPE, but it's,
Right.
So it's a reimbursement.
May I add?
Sure.
So early on, the state laboratory, and ours being in the closest one in Tampa, was the only laboratories in the state that were testing. So the physicians in the emergency rooms were actually calling us to get permission to, if the patient didn't meet the criteria to go to the state laboratory, to utilize LabCorp Request. And since then, we have many, many other laboratories as well, in terms of the diagnosis that they were seeing, even though the person didn't originally meet the strict criteria for COVID, the physicians felt that may be a case, and so therefore they were asking to test outside the system. So that was happening a lot early on. What I will say is regardless of how many times an individual is tested, it only counts as one when they're positive. So they have a medical record that's developed, and physicians may test them routinely because, as you heard, it takes time to develop. So you could be negative today, but you could, in theory, be positive tomorrow. So again, all of these numbers that we're giving you, it's based on one case, an individual person, not the amount of times tested. And that includes the overall number, the 78,000 as well. That's individual who were tested, not the numbers of times they were tested.
Okay, thank you, Dr. Bensi. We've heard from Dr. Bensi. I think you have it for the record. Sir, could you please state your name for the record, doctor, and your title for the record, please?
Yes, Dr. Edwin Hernandez. I am the Clinical Director for the Florida Department of Health, Manatee County.
Thank you. I want to make sure. Clerk got that. Okay. Misty.
Oh, thank you very much. Dr. Bensi and Dr. Hernandez, thank you for being here. It's really important that we hear from the experts, and I appreciate your time. I have a few questions to which I think you've answered, but because I receive these same questions over and over, I think it's really important that I ask them and you give an answer. So thank you for indulging me. So can you tell me, what is the scientific data being used to support masks?
I believe what I explained is that there is, in this virus, this asymptomatic or pre-symptomatic phase where people can spread the disease without knowing they have it. So that's why the masks are vital. Every virus is different in terms of how they present. In this case, as we said, it lives more in the nose and the mouth versus deep down in the lungs. So the chances of it coming out externally into the environment and causing it to be put into someone else through their mouth, through their eyes, through their nose, transmission on surfaces, less so. But again, this is very much through respiratory droplets.
Right, and I guess the picture that you gave to us from Florida Atlantic University is a scientific test that shows just what you were saying, that the masks do decrease the amount of droplets. Okay, thank you. And so question 2, how do we know that masks will make people safer? I keep hearing that, but you just explained that, because it's going to contain, to correct me if I'm wrong, it's going to contain any respiratory droplets that may leave someone who may be infected and not even know it, or may be infected and know it, right?
Absolutely.
So that's the goal, whether it's this kind of mask or a paper mask or an N95 or a shield, they all do a job at containing those droplets. Okay. How will we measure success or failure? So I heard the statistics that you gave us in the first week and then thereafter. Are you going to be doing those same kind of measurements in Manatee County and providing that to the public?
Yes, the information that is on the State Department of Health website we look at daily. If I could remind you, back in end of May, early June, our positivity rate was about 2 to 3%. Right now, it's over 11%. Some days it's high as 20%, but we look at averages because we know sometimes the laboratory is putting a lot of information into the system at one time. So we don't want to look at one particular day only, but looking at the last week, the last 2 weeks, the last month, and our rates have increased, and they're not going down. And if we have issues like school coming back online and in brick and mortar, we need to be concerned because no one is living in the bubble other than the NBA and the WNBA, hopefully. But other than that, we are living together in a community, and we're crossing paths. And I think the long-term care facilities is the perfect example, because while those residents predominantly were staying in those nursing homes, the staff were coming in and out, and that's what caused the virus and the spread in those facilities. So you have to work together as a community. You have to bring the rates down, and I think being able to get our rates back to where they were, 2 to 3% versus what we're seeing now, over 10%, is the only way we're going to see any type of positive trending for better health and less deaths. in our community due to COVID.
Okay, and I'm glad you brought up the labs, because something that I hear a lot is that and we've all read the stories, that the labs incorrectly reported their data, that they're not analyzing their data the same way or the proper way. Some labs were reporting over 100% positive cases. Can you just address that? Because that is a trust issue with the community. And that's when we begin to lose people, when they see stuff like that and they say, oh, forget it. I don't trust anything they say.
So again, I would encourage everyone to go to the Florida Department of Health website and read at the top of every graph or chart what the terminology is. For example, when we talk about number of cases, those are persons who tested positive through a polymerase chain reaction or the nasal swab test that most of the facilities in our community are doing, or an antigen test, which is a rapid test. So those are included in the positives. In terms of antibodies, as was mentioned earlier, that's a blood test, and that is to show that you've had the disease in the past. And then you can give plasma to help others who are fighting the virus. If you look at the number of laboratories on the DOH pages, it goes on. There are hundreds, if not thousands, of laboratories. We have sent lab work to Oregon, to California. There are contracts made daily in Tallahassee through emergency management and the Department of Health with any laboratory in the country that can perform these types of measures. And it's a good thing that more people are going to be tested. The problem is the labs are not turning them around fast enough. We know that. So what you're referring to in the one case was a small laboratory, and they were not reporting the negatives. They were only reporting the positives. So in that case, it didn't throw off the numbers in terms of being statistically significant because we're doing so much testing. So when you hear a glitch, yes, it's happened, but it's not going to make a dent in what we're talking about.
Okay, yeah, that's great to hear. And Commissioner Whitmore touched on this a little bit. So I also often hear that the death rate is inflated, that the government gets money every time someone dies of COVID, and that people are dying with COVID, but not necessarily by COVID, but they're all being marked the same. So can you please address that? Is that true? If someone has a heart attack or has a heart condition and then also tests positive for COVID and passes away, and I guess every case would be different, I understand that, but can you kind of address the concerns of the public that we're just doing all we can to get as many COVID deaths on the books?
And I'm sorry that Dr. Vega, our medical examiner, is not here because he is the one that is dealing with this issue, and we keep in very close contact with Dr. Vega and send our reports to him every Friday. So his responsibility is to determine if the individual passed away from COVID or something else. And there are guidelines that he follows and that the physicians who sign the death certificates follow, regarding if the person was diagnosed with COVID, for example, in the last 30 days versus an automobile accident that he knows the COVID did not cause. So he would be the one to speak to, but again, he is very engaged in what is happening, and it's his responsibility to make sure that he is putting correctly on the death certificate or reinforcing what the physician has said regarding those deaths.
Okay, and then my final question is I hear about people in line for testing, like at UTC Mall, and they get a piece of paper to fill out all of their information, their name and address, et cetera, and then they tire of waiting, and so they leave, and then they get a letter in the mail that says they were positive. Now, this kind of rumor, does circulate and catch fire, and there's a lot of that, I'm sure, is not true. But, there are people claiming it happened to them. So can you kind of take us through the process of when you're waiting in line? Can you just fill something out and hand it in and leave? Is that a possibility?
So that particular site is being run by the State Department of Emergency Management. The Department of Health, we're not involved in that one, nor are we directly involved with Lincoln Park or Home Depot. Our staff has been doing the ones at the convention center here, the drive-throughs, and now we are going out and doing testing at mobile home parks and in the migrant community. We also are working very closely with MCR, our federally qualified health center. They have done over 15,000 of our tests in our community. So kudos to them. I believe that that's a reason why our numbers are as good as they are regarding doing community-wide testing. And also they are in the underserved areas, and it's very important that we get data and we test everyone in our community, not just a certain population based on socioeconomics. But I will ask Director Sauer if you have any additional information about UTC. Again, I know it's emergency management, and I have seen only on TV where somebody stepped out of the line and their paperwork was handed in, and that happened. So I can't validate that. I haven't spoken to anyone, but I've heard the same possibility.
Yep. Yes, ma'am. I had the opportunity to speak with the director of Florida Department of Emergency Management. We have asked the UTC site. They know of 1 or 2 cases that has occurred, and they attribute that to much like a McDonald's drive-through. So if I place my order, 2 cars in front of me, and then I place my order, I fill out a sheet of my data information, turn it in to the drive-through window, but I'm not up to the window yet, and I decide that I need to leave. That vehicle moves out. That's the order of the testing. So if that vehicle moves out, they just assume the next person is that test. But in talking with the state and talking with UTC, they do not believe that it's an aberrance in the testing of a false negative, false positive. It was someone that tested positive.
Okay, thank you. Thank you all.
If I might, I went to UTC on Saturday. You do not fill out any paperwork. You do not handle any paperwork. You drive up, you show them your driver's license, they write the information down. There's no filling out paperwork and getting a number. So I saw that played on ABC 7 about how it had happened somewhere. I didn't hear it attributed to UTC, that this getting out of line, but I feel like I need to come forward and say that's not how it's done at UTC. Now, granted, there was 1 car in front of me. I don't know what happened with them. I just know what happened with me. But they don't touch anything. You do not pass anything back and forth. They're very cautious. As I said, you hold up your driver's license. They write the information down.
Oh.
What happens after that with that, I do not know. I've not received my results, but I'm just saying that I did do it on Saturday in abundance of caution because I'd been on a plane earlier in the week, and my daughter insisted kind of on it. So that's what I did, and I'm just filling you in that that's the fact as I experienced it. Reggie, you're up next.
All right, thank you all for being here today. You made a statement earlier about it's very easy for you to be negative today and positive tomorrow. Just for understanding from the community standpoint, can you expound on that a little bit, on how that could take place?
Yes, sir. As I mentioned earlier, almost half of our cases are asymptomatic. So if you're not feeling ill, you may not have, in your mind, a need to be tested. However, you could become pre-symptomatic, as we said later on, and start developing symptoms and go a week later, and then you would be positive. So it just depends on the day you go and if there's enough viral load, as was mentioned, in your system to test positive. And again, the test that we're using at these majority of labs involves PCR, polymerase chain reaction, which looks at the proteins. So you have to have enough of that to be positive. So that is why those tests could be positive one day, negative one day, positive the next. The other is with the antigen tests. It's not using PCR because you're doing it in a laboratory approved setting, but in an urgent care, for example. And so that also is a swab, but you're still testing the protein, but not as specifically as the PCR. So there's an 87% accuracy to it, but sometimes people test negative. So if you get a negative antigen test, the physician may say, well, you're symptomatic, you're not feeling well, let's test you again in a couple days and see if the viral load has increased to make sure you're accurate, or go to a PCR test, but it's going to take you, at least 3 days, if not longer, to get that back. But in all of those cases, we really emphasize people to stay home if they can, if they're feeling anything, and they're waiting for a test result, because you don't want to spread it. Or some of our providers are low risk, they're going back to work, but again, the mask is the key.
So I understood that, but I wanted those bullet points to be, expounded upon for individuals in the community that may be listening. You also spoke about the number as far as 875 kids in Manatee County that's tested positive. Within your expertise, I think you're serving Manatee and Sarasota County, am I correct?
Just Manatee.
Just Manatee, and you're communicating with the municipalities and the school district as well, ma'am?
Yes, sir.
So, and I'm not taking a shot at the school district or anything like that, but I got to say this. We already know that 875 kids are have tested positive, and the concern that's out there for school to start. Do you have a comment on that or a recommendation in that area, ma'am?
Yes, sir. As I told the school board a few weeks ago, they have a good plan. They really have worked on a lot of the details as it relates to infection control. However, there is not a bubble. They won't be living together 24/7. They will be in the community. And once they go out into the community, like what we saw in the nursing homes early on, the long-term care facilities, people bring it back in with them the next day. And particularly with children overall, even though we do have 875 positive, there's a lot of them who are asymptomatic, who have it, but they're not showing signs and symptoms, not telling their parents they don't feel ill, and therefore they're not being tested. So we haven't done the testing on children at the same rate we have done on adults.
Right, and I understand that, and that was kind of a message to the abroad with the concern of the momentum as far as school about to come back in here with all the underlying health conditions teachers could have and things like that. I do think from the county commissioner's perspective, we do have a responsibility to at least attempt to address that from a public safety standpoint and have some comments on it. With us, where we are right now, and with the consideration of masks out there, are we looking for a specific number as far as are we going to target 5% or 4% when we're saying it's less likely where we as a population should have to wear masks? Or do we have that number in mind, or we're not there just yet?
As I stated earlier, back in May and June, we were about 2.2%. I think it would be a goal as a community for us to come to a decision on, getting back down to that number to ensure safety in our community and people being able to go to work, to be in school. We need to get back to where we were.
And last one, Madam Chair, last one. So that number would be obviously below 5% when we would say consider it. So and then I think my next commentary would be as far as, because I've received some emails where someone, 2 or 3 individuals talking about masks for 14 days, masks for 7 days, or masks for 30 days. We can't gauge it like that. We have to gauge it from a standpoint of where we are on that percentage. And right now, it seems like the target is below 5%. Am I correct?
That would be a wonderful response.
All right, thank you.
Okay. Next up is Vanessa.
Dr. Bensi, thank you for being with us today. I wish you would come in here more often. We need to hear more often from you. I run into you all the time at Publix. We shop at the same grocery store, but it's kind of hard to have an in-depth conversation on COVID when we're standing there. You had some good information, but I don't know that I got it all. So if please help me with this. You mentioned that 5,743 people had recovered I'm really glad to hear that, because I've been trying to get those numbers for months, and they're rarely available. I don't know why that is. Maybe you can help me with that. We have 7,000, as of last night, 7,774 positive cases. Basically, if you take and you subtract the 5,700 that you were talking about, the 156 in the fatalities, we're probably around, I'm just going to round it up to 1,900 people that still are suffering from COVID. Is that fair to say?
Based on our epidemiology, what we do is look at the number of cases total that we have, subtract those who have passed away,
Yeah.
and then also subtract those who are contagious. So at that point in time, it's anybody who we've contacted who has, we know have been positive since the 16th of July. So we have to go into our epidemiology system. The database is Merlin statewide, and then our epidemiologists can draw that data out of the system. It's not readily available.
Yeah, I know, and I have to tell you, the reason I brought this up is because I hear this almost every day from citizens wanting this information. So I don't know how perhaps we might be able, as commissioners, to start getting that information more often, Dr. Bency, so that we can share it, because, people are on edge. I'm not even going to tell you what the definition of fear is. Never mind. And then you mentioned, too, and I was shocked, 48%. Asymptomatic. How did you come up with that percentage? Where did that come from? That is amazing to me, 48%.
So again, it was the total number that we had positive, minus the deceased, minus those who are contagious at this point, which means they were symptomatic from 7/16 on. So that number have recovered. Is that what you were asking?
No, I'm sorry, that's not helping me, because if I think of asymptomatic, maybe I'm thinking of it wrong. I'm not a nurse, I'm just a jeweler and a county commissioner. But when I look at it, when you say that word to me, I'm thinking of someone that, maybe has COVID, but they're not showing any symptoms of anything. To me, I thought that's what asymptomatic was. That's why I'm asking on that note. How would we know?
So the number that I just gave you are the recovered.
Right.
The individuals who had it,
Right.
tested for it, were positive, and have recovered from it. So that's that number. Asymptomatic is somebody who has the virus in their system but don't show any signs or symptoms at all.
Correct.
That they have it. So fortunately for us in Manatee County, we are doing quite a bit of general testing, not testing only people who have symptoms. So we can determine how many are positive. So with that, my epidemiologists go into the system, and you can also check for those who they called because they were positive but never showed symptoms. And those are the ones who are defined as asymptomatic,
Okay.
but they carry the
So
virus.
that's where the difference comes in. It's people that come up and say, I don't really have any symptoms, but I want to get tested, and they come back and they're positive, asymptomatic.
Right.
Correct?
Correct.
Okay. So you're assuming then that that's around 48% of our population as a whole. Is that
Based on the data,
Fair?
yes.
okay? I just wanted to make sure I was right on that. Okay. Now, let me ask you about this. Misty Servio was wonderful about asking all these questions from the community. We're all getting them. False positives. How do you deal with those?
So when you hear the term false positive, the majority of those are going to be in the antibody testing. So as I mentioned earlier, the ones that the majority of people are getting now, the PCR, the nasal swabs, those are accurate. That is a very, very, very scientific method, PCR, polymerase chain reactions. The antigen testing, again, is for rapid test. Are you positive at this moment? Those are 87% accurate, but they can give false negatives. So as I mentioned earlier, it's important that you work with your physician to determine if you have any symptoms, and then potentially you could be retested in a couple days to determine if you truly are positive or if you have a sinus infection or something else. The antibody testing is where we're seeing false positives. And so that's the test you take to see if you already had the virus. And because coronavirus falls into a category of viruses that include colds, and that there is a chance that you could be testing positive for a cold versus the antibody that you already had the coronavirus that we're speaking of, COVID-19. But again, when you look at the numbers, minute in terms of the overall testing. And those,
Dr.
again,
Benzie,
are...
Just so you know, the reason I'm asking that question is because I do know of 2 Manatee County employees who tested positive for COVID, not an antibody, but positive for COVID. And then they both went back and took the test again, and it came back negative. That's why I was asking that question, because you hear about it so often. So that's why I was asking. But anyway, if you could indulge me just 2 more, because I really am so glad you're here. Talking about the medical examiner. Now, I've been told that the medical examiner does not perform autopsies on COVID patients, that they just go by whatever the doctor has said. Do we know? I'm sure you know.
We're in close contact with Dr. Vega, as I said, and he's not routinely testing on autopsies, but there are criteria that he's following. Dr. Hernandez, do you want to add anything?
Yes, it's important to understand that a lot of patients that passed away that have comorbidity with other conditions that may be a factor for that particular death. And that information is related to Dr. Vega, and then he will proceed to the next step. We all know that COVID causes this inflammatory syndrome in our body, and people that have history, heart disease history, might have a heart attack secondary to the inflammatory process that is happening in the body. So that's why this is very important, the collection of history and that exchange to not only the providers that are under care in these patients, but also once a death occurs, the information have to go as a package.
And I thank you for that information, because it's also my understanding that because of autopsies not being done, it does come into play as to whether or not that patient had other medical issues. I mean, they do come into play, very much so, especially when dealing with COVID. So that's why I really wanted to be able to get a straight answer from you guys on it, because it comes up all the time. And, Lord have mercy, I can assure you I'm not a medical examiner, and I don't want to be, but I don't know what to say to people when they ask those questions. So it is safe to say that COVID is a factor in a death, but a lot of times there are other health issues that have made it worse.
Correct.
Is that fair to say?
Yes.
Okay, but is it also fair to say that because of that 9 times out of 10 it says COVID on the death certificate? It comes up all the time. I'm sure other commissioners hear that as well.
Right. When they extend the death certificate, they have to put in there everything that is found as the result of the autopsy.
But they're not really doing an autopsy, right?
They do post-mortem testing on this patient.
Okay. Okay. All right, one more question, and thank you so much, because these things have been bugging me for a while. Fatalities, Dr. Benzie. We used to, as you know, Florida Department of Health on their website had at one time all the fatalities for all the different counties listed. Didn't have names or anything like that, but it did say, male, and age, and the date that they passed away. Well, we're not getting that information anymore. So it's really, I know you mentioned, Dr. Benzie, about long-term care facilities, and that evidently, I think you said it was going back up. But to tell you the truth, I was writing so fast, I'm sure I missed part of that. So if you could go over it again, I'd really appreciate it.
Yes. So the issue that we're having, and we've been touching on the long-term care facilities since February, March, it started, where we had the outbreak in the 2 facilities toward the end of March and brought in teams. And after that, we put a mission request into the state and had 8 nurses who have been with us since that day. Actually, Easter morning, they arrived. And their responsibility under the direction of Dr. Hernandez and his team is to go out daily into these various facilities to find out what is happening. Are there persons under investigation, PUIs as we call them? Do they need more PPE? What is the issue? And really, what is their infection control like? So that is a big piece of it. And we work with ACA. They're the agency in the state of Florida who regulates these types of facilities, the Agency for Healthcare Administration. They don't have as many staff as we do, and we're present in the community where they are more regional, so therefore it made sense for us to be the contact, if you will. So anyway, these nurses have come in, they report to our office every morning, get their PPE, and then are given assignments on where to go. And then they come back at the end of the day and report their findings. In the meantime, our school health nurses, because they haven't been in school since the spring, also are assigned. Every facility is contacted every morning by one of them to determine, again, what are the issues. So we take all that information, collect that, and make sure we're addressing it with leadership in those facilities. We also have the regional IMT, the Regional Incident Management Team out of the state, and they are responsible for the 10 counties in the Florida Domestic Security region that we are in, Region 6. And so they are assigning, based on our findings, testing teams to go in, because they have to test now every 2 weeks in the long-term care facilities, both the residents and the staff. And then they will also go in and do an additional infection review if we deem that our team keeps finding issues every time. So a lot going on. And even with all of that said, the numbers are starting to increase again in the facilities because, again, the staff are bringing it in. And the infection control is not working in the facilities when that happens. So if the community were better in controlling it, we would see better results in the nursing home. Fortunately, knock on wood, the jail, we haven't had too many issues. It's been pretty well under control. That has not been the case in other counties where they have had many, many tens of individuals, hundreds of individuals exposed in that setting. We do not want that. We have, and fortunately, again, we have not gone there. But every time you talk about going into a facility, we talk about fire, we talk about EMS doing responses and how long it takes them to suit up every time. And we're still seeing some exposures. And Director Sauer, he's the one that can tell you much more about that. But if everybody wore a mask, it would greatly reduce that potential spread, whether from the mouth to the nose, the mouth to the eyes, and in all of these settings that we're talking about today.
Okay. I'm sorry, Dr. Bensi, I don't think you understood my question, but thank you for the information. I'm going to assume in these long-term care facilities, when these workers are going in to go to, they are wearing masks, correct? I just want to make sure that they do wear masks in those long-term care facilities.
Yes,
I mean, surely they do.
Their temperature's taken. However, it's infection control. And they don't wear the same mask all day. As they go from patient to patient, they have to change their PPE.
Right, good.
So those type of issues, and Dr. Hernandez has been living this for the last 5 months, so I will ask him to elaborate on any potential issues here.
Yes, earlier when Commissioner Servia asked about the studies, I thought that perhaps one thing that we need to go back and look at our experiences since March and how these have played evidence-based when behaviors change, along with a lot of concerns in some of the long-term care facilities, come also out of them success stories, facilities that have decided to embrace recommendations. Infectious control is one term that we look very comprehensively. In the past week, the infectious control director of the World Health Organization, she stated that the comprehensiveness of our studies in infectious control is what is going to determine the spread of this virus. And I'm very proud to say that our assessments are very comprehensive in terms of not only looking for risk to spread COVID, but also risk that will put comorbidity of clients also in the line and deteriorate their immune function as well. So we have many facilities that have embraced these recommendations and have succeeded in terms of the spreads. It is clearly that those that do not embrace and allow the traffic, the flow of people in and out, including health providers coming into the facilities, or when patients are going to doctor's visits without any kind of barriers, wearing any barriers coming in or out of the facility, it plays a role in this spread of the virus. So we're working actively with administration to standardize a message not only at the level of the local level in the facility with the administrators, but also at the ACA level to make sure that we all have a standardized message. People need to hear a standardized message and not a conflictive message in order to change behavior so we can change these trends.
Thank you for that, because I have to tell you, it would seem to me our long-term care facilities where masks are mandatory and have been for quite a while, I would think that masks, as well as they work, so I hear, I would certainly think that it would be under control. But that being said, my question really is about fatalities. Where can we find out the information about the Manatee residents that we are losing to this virus? How can we know? Are they long-term care? Are they younger people? Are they older people? Where are they? We need to be able to tell our citizens so that they know, because here they get this information on zip codes. Well, a lot of times the citizens don't understand. I don't know how many times I've had to say it, that, yes, I know you live in 34208, but you got to remember, Manatee Memorial is in that. You've got a couple of Manatee Rural Health areas in there. You've got some other areas getting tested. So that's why it's so high, but people don't understand. So if we could go back to having the information, and maybe it's somewhere and I just don't know where, on fatalities, so that our citizens could be better informed about who, not by name, obviously, but, yes, female, 66 years old, succumbed, to COVID or whatever. Give us some idea so that the citizens are more aware, because that helps to hold down the fear, is I guess what I'm trying to say here.
Looking at today's data from the Florida Department of Health website, we know that 92 of the deaths reported in our county were related to long-term care facilities. As it relates to deaths, we've had 50 or 32%, the largest group, in the 85 plus. In the 75 to 84, we had 48 deaths or 31%. We had 28 or 18% in the 65 to 74, followed by 21 or 13% in the 55 to 64, and it goes down from there with our one in the youngest that we have. Let me verify that it's in the 25 to 34.
I'm assuming you're finding that, Dr. Bensi, on the Department of Health?
Yes, ma'am.
Because I have seen the age groups, but I've not seen the one for long-term care facilities. That's why I was asking.
Yes. And so if you look at our long-term care cases, it's 590, which is 7% of all our cases. Last week it was 6%, which is also the statewide average. So we're going up a little bit in terms of cases coming out of long-term care facilities.
But the employees going in and out of there do get tested every 2 weeks.
And the residents also, yes.
Wow. Okay. Thank y'all so much. That's good information to have.
Okay, Priscilla.
Yes, okay. I have a question on these masks. I understand that medical people use them once and then throw one like this out. I know a ton of people, we hang them on our rearview mirrors, we stuff them in our pocket, stuff them in our purse, and we reuse them a lot.
It's better than nothing.
How effective are they in the second week after I'm just saying, I mean,
Right.
hey, that is what people are doing. They're wearing a mask, but I will not say that they are switching masks every time they use one. So how exactly effective is this if you can't wash all of them. I know you have the ones that you can wash, but still people are using them multiple, and I do mean multiple times.
Yep.
And how effective are they on multiple use? Please.
Exactly. Yes, thank you. So what is recommended for the public are actually the cloth masks. We distributed 15 million through the Florida Department of Health last month, almost 400,000 alone in Manatee County. Those are washable. You can wear them up to 15 times if you wash them in between. So those are the best for the community at large. The surgical, obviously, as you said, they're better in the hospital setting. N95s, as was stated in the document, really only should be in the hospital setting. So there are different masks, and the ones that people make, as long as they have 2 layers, those are considered ideal.
Still, if someone is using this, which they are, how effective is it after the 15th time, the 18th time, or however many times they've used?
Right, and it shouldn't
is it still
be
effective, or it's not effective at all, or?
It
what?
depends on the usage of it. I mean, if it has
Wet.
film and wet, on it, then no. But if you put it out in the sunlight and it's clean, then it's going to last longer. Do we recommend using it for more than, a few days? Not ideally. But again, is it some protection versus something else? But yes. However, we need to come together. We put in for CARES funding dollars for quite a few masks for the community. And again, if we get the cloth ones like we did through the Department of Health, then those can last much longer. This is not an infection that's going to go away anytime soon. And until we get a vaccine that people choose to take, we are going to have to deal with the spread of this virus and hopefully being able to contain it somehow. And the cloth masks are the best way to do that in general for the public.
I do agree with you in that sense. We are going to have to learn to live with this for, if we're lucky, 6 months. That would be very lucky. So thank you.
Okay, I'm going to ask a few questions, and I've got some other commissioners on the board. So the number one thing that we hear in opposition, or that I've heard and read in opposition to this idea of mandating masks, is that this is all overblown, that this is no more than what we see routinely, flu, those kind of diseases. This is all just totally overblown. The death rate is so low. I could give you the percentage, but I can guarantee at least 10 people in here would correct me because they know exactly what the percentage of population death rate is. Because it's the number one thing that I hear from folks that do not believe that we need to take such a drastic measure, that the local government should not even be considering such a drastic measure, since this is so scandemic, totally overblown. I know you guys, I'm not saying anything, you've all have heard this. I've received a report, which I forwarded to you, that said that the CDC says masks are ineffective for influenza, and I forwarded that to Dr. Bensi and asked her to be prepared to comment on that. I also have done a lot of research, and most recently, and I also hear that all of this information is fake news, that it's being manipulated to try to create this issue. We're all hearing that. This is not news to any of us, I don't believe, if you read your emails. So I try to research this and try to read things, but you don't know. Is it true what you're reading? But the article that I looked at that was in the Tampa Bay Times, don't know anything about the Tampa Bay Times, to tell you the truth. It says, and I'm going to ask this is my second question. First question you got, right? The second question is, the coronavirus is the deadliest infectious disease in Florida this year, according to data from the Department of Health. At its current rate, the virus is killing 3 times more Floridians each day than AIDS, viral hepatitis, the flu, and pneumonia combined. Can you comment on that, what is written here? Because I hear the opposite. I hear that this that we're way overblowing this low death rate, which I understand is lower in Florida than it is in New York, even though we have way more cases. So if you have any comment regarding that, I would like to hear that too. So there you go.
First thing that comes to mind to me in that comment is Valerie Tibbetts and what she's going through right now. And she had her husband a few months ago, and she doesn't anymore because of something known as COVID-19. In terms of long-term effects on cases, people who have recovered, we have many people who have recovered. If you've spoken to anybody who's experienced it, the symptoms can be overwhelming, and they present in many different formats. And we don't know how it affects your body long term. Those studies will continue on for years. In terms of the flu, we're talking COVID-19. We're not talking influenza here. So it concerns me when people pull something out about influenza and the CDC says there is a vaccine for influenza. There is herd immunity for influenza. We will be dealing with influenza very soon, and we're going to be promoting the vaccines in our schools and our community like we do every year, starting very soon. And then how will those two interact? That is yet to be told. This is a new virus. We are learning about it hourly, but we need to be cautious and not take risks unnecessarily. As it relates to the other counties, I want to reiterate, so those that do have mask mandates that are similar to us, why are their numbers lower? Brevard has 5,000 cases. Pasco has 5,900 cases. Volusia, 6,300. Seminole, 6,100. They're not spreading it. They're not moving it. And they are doing nearly as much testing, and some of them more testing. So what's the difference here? It is spreading. There's a virus in our community that's spreading. Do we not want to try to minimize its effects, both in terms of potential long-term care issues, deaths, and just what it does to the individual while they're experiencing it, and making them stay home and not be able to do the things they want to do, and again, risking in multi-generational families the potential for a deadly disease. Your second question, we monitor all of this data. Dr. Hernandez, I know your team oversees that. You have a lot of experience with HIV/AIDS over the years. Again, flu, we have vaccines, we have herd immunity. Pneumonia, we want pneumonia shots, particularly for the elderly. Do you want to elaborate on those numbers?
Yes, my take with this is that when I hear comments like that in the community, I strongly believe that when we look at illnesses that could be preventable, it could be by behavior or by vaccine, one death is too many, because there's always that possibility that we could prevent it. And when we look at trends in the community, at evidence-based in other communities, this take a big role. Numbers, they don't lie and have to be acknowledged as they are coming to our lives as such. So I truly believe that when we consider low incident of death on a particular illness, especially in one that is an emerging disease in the community, there are many other factors that are going to be revealed as time progresses. And we consider a flu, for example. In the case of flu, the virus is only shed out of the body when you have symptoms exclusively. That is not the case with COVID. With COVID, you can be expelled out of your system with a lower amount of viral load in the system. So that is concerning when you think of measures and preventive strategies in order to spread the disease.
Okay, thank you. Carol?
Just real quick, because I know we have a million people wanting to make
we
public
do.
comment, plus on the phone. First of all, I serve on the Medical Examiners Commission, as you know, and not every patient that passes away in Manatee County gets an autopsy. And I actually I was on a probable cause panel not too long ago and had to see all the pictures of it, and I'm used to saving lives, not seeing that. So trust me. And the only way that they get a autopsy, if they have criteria, if it's an accident, unknown death, or the family requests it, correct? As far as you know, doctor? Okay. And, but what you're seeing, I hadn't heard anything from anybody about, Dr. Vega or all them cooking the diagnoses, and I know he wouldn't anyway. I've known him for years. But they get the chart from the hospital, and they go through the chart, and they see all the diagnosis codes and what the patient's being treated for, the x-rays, the lab results, all that, and then he puts it all together to the cause of death, correct? Okay, I just want to put that on the record because I just wanted to make sure. And you report to the governor, correct? You report to the state health department, the Florida Department of Health, but you're under the governor, right? You're under the state.
Yes.
So there's no reason for you to give us any other information other than what you're being directed to, and all the other health departments in the state of Florida, correct? Okay. It was very interesting about the antibody testing, and Jake has been telling us that the numbers were minimal, but we had our friend Michelle that was very passionate about this, and she had brought this issue up. So if a patient gets negative but has symptoms, they still should have the nasal swab, correct? That's kind of what you said a little while ago?
Correct.
Because the antibodies aren't always correct. But they are counted in the numbers if they are positive, right, with the state. And once you're positive once, like Carol Whitmore, she's positive. If I get negative and then all of a sudden I get positive again, it's only counted once, correct?
Correct.
Because we have a chart up there with demographics, so, okay, good. And I'm glad you mentioned about the flu A and B, because I had mentioned that. TB, how is that spread? I know, but I want to hear because I think the public needs to know. This is a different virus, TB, and it's spread by droplets, correct?
Correct. It's a bacteria.
Okay. And is this how is this different than COVID?
COVID is because of the amount of bacteria, virus that can be expelled at one. When you talk, it's easier to transmit than the weight of the bacteria itself. So that takes a big piece of the consideration of the spread.
And you've done a yeoman's job. I've known the health department for many years. They've done the AIDS clinics for years. They've done all the transmitted diseases that you have to monitor with the state. Doctors have to report certain diagnoses, bacteria, et cetera, to the health department, and that's collected by the state. So you've done a yeoman's job on this, and I can't thank you enough for doing this. I know I've talked to Dr. Bensi at 10:30 at night through all this, and it seems like we're always working, but I just want to thank you. You have no reason but to give us the data. And actually, our citizens are wanting the data. Some of us are just looking at it differently, and I respect their opinion. But I am totally going to support this mask resolution. So whenever it's time, I know we got a long day or a lot of comments ahead, but I totally support this because from exactly what you said, Dr. Bensi, other counties that are larger than us have been able to control their numbers better than us. So what do we have to lose besides another person, whether he's young or old? Who cares? It's a life of one of our citizens in Manatee County. So, and again, I had a friend just yesterday who came in for a heart condition, and they discharged her today. They've done a COVID test, but they did an X-ray that showed the glassine in the lungs. So she either has it now and no symptoms, and she's an RN, no symptoms. She's a corporate in the healthcare world, never a symptom. So you just don't know. And like Vanessa said, you can be walking around with no symptoms. So I'm looking forward to hearing what the public has to say. Thank you.
Okay, we've got a few commissioners, then we're going to take a break, and then we're going to go through the resolution as presented, and then we're going to go to public comment. So it takes a while to get all this out, but that's the way it works in local government. Misty, then I'm going to go to Steve and then Vanessa.
Okay, thank you. Just a few more questions. I neglected to ask this one. It's one that I hear often. I know that our governor, one of the most important metrics that he asks us to look at is the percentage of positive cases. So of all the tests that are taken, what percentage is positive? That's a very important metric. But some people have asked me or have said, in Manatee County, we have 412,000 people, and we need to look at the percentage positive based on the entire population, not based on just those who are tested. And when you do that, it's just so small, it's so insignificant. I guess, my first reaction to that is, well, it changes every day. But I would like your comments on that. Why aren't we taking into account the entire population of a county when looking at the percent positive?
So the first would be resources. How do you test everyone? We just haven't been able to do that. And the governor's goal was to do 2% per month. We are way above that. So again, kudos to MCR and to emergency management and everyone doing that process. I think that you have to look at the science, and you always look at that. And the asymptomatics are the key in this disease. There are many people out there that probably have it, but they haven't been tested yet. But we are doing a good job of opening the gates and saying, come and be tested even if you don't have symptoms. We want to know. And for our positivity rate to be over 10% in that situation says that there is the spread of disease in our community, because if they weren't, and the numbers would be much lower regardless of how many people we're testing, the percentage would be lower. So again, we're testing a lot of people, but the positivity rate of who we're testing is high, and we are doing a cross-section of the community. So it says to us that the virus is out there, and it's not just automatically the more you test, the more you're fine. That's not necessarily the case, because you can have low positivity rates and test a lot of people, but we're not seeing that.
So what I'm hearing then is the appropriate ratio or percentage is the percentage positive of those who have been tested, not the percentage positive of the entire population. That would not be an appropriate ratio to assess where we are. I don't want to put words in your mouth, but is that correct?
Yes. And then you also need to look at what you're measuring, because you can look at the positivity rate from the day we started testing to today. That's one. You can look at today's, and I said that's something you look at, but again, it varies in terms of the labs, as we say, dumping the data into the system. So we look at 7-day trends, 14-day trends, try to look at as much of that as possible to see, are we going up? Are we going down? Are we staying the same?
Okay. And then I just want to clearly understand the 48% asymptomatic people. Is that 48% of the positive cases or 48% of the population? Because I thought I heard both.
It's of the cases. So we have the history on those individuals.
Right.
Once they test positive, we are in touch with them, and then we ask those questions and find out if they are symptomatic or asymptomatic throughout the process.
So almost half the people who test positive have no symptoms that they can explain. Okay. And then I thought Commissioner Ball brought up a really good point in the zip codes. And she said in 34208, we have to remember Manatee Memorial Hospital is in that zip code. So are all the positive cases at Manatee Memorial Hospital tracked as living or being in 34208, or are they tracked where they reside?
It's always where the individual resides.
Okay.
And I'll take everybody back to the first case. In Manatee County, that individual actually was in the hospital in Sarasota, but was considered a Manatee County case because the address was Manatee County.
Okay. And then my last question is, I personally have not met a medical doctor who says that masks aren't effective and who does not recommend people wearing them. But I hear often from people that they have talked to doctors who don't recommend masks and do not think a mandate is necessary. In fact, I think we have one medical doctor in the audience who will tell us today why masks are not effective. So my question to you is, how many doctors, your colleagues, do you know that say, we really don't need to do this, this is an overreach? Do you know? Do you know any, or do you know a few, or can you just estimate?
I have not spoken to any who are against masks. I know they work in the hospital setting, if they work in the urgent care settings, it's part of what you do every day in healthcare.
And Dr. Hernandez, do you know any?
Yes, we have meetings with medical directors of all long-term care facilities, and they all agree that mask is necessary.
So neither of you know any medical doctors who would say that this is an overreach, or it's not necessary, or it's not effective. Is that correct? Okay.
That is correct.
Okay, thank you.
All right. Commissioner Johnson, out there on the couch and hanging out.
Feet up, watching TV.
Got a question for us?
I'm the only responsible one.
You are the most responsible, the most protected.
I just,
Amen to that.
really have
Now
one
vote that
question,
way.
and I guess that's always, because it comes from my background, but before I ask that, again, I would compliment Dr. Bensi and Dr. Fernandez and all, Jake, we get those reports from Sherry every night. I'm thinking this poor girl, 7 days a week is twice a day,
March.
pumping out all these spreadsheets on, you can go stir crazy, I think, sometimes looking at all the numbers and things of that sort. But really, my question, of course, comes down to money. Somebody's going to be paying the bill for all this stuff. And is there, because I'm somewhat of a conspiracy theorist, is there an incentive to have more positive cases? And, when it comes time for reimbursement, are we anticipating the hospitals, coming to us saying, hey, we need all this money that we've now spent on this thing? And I know that the state's been very generous and the federal government has. But are there any, again, I guess I would call them financial incentives to, I don't want to say manipulate the numbers, but let's just say to manipulate the numbers so that it shows more positives, or that if we get more negatives, or, all those different metrics that are used there, I'm just always suspicious, at the end of the day when it comes time to write the checks, because you guys have been doing a yeoman's job and at all the test sites, but somebody's got to be paying their salaries. And, so, has there been any transparency disclosure on, where the money, how is it going to be distributed? Who is it going to be up to make the decision as to who gets reimbursed what? I know Dr. Bensi, you and your group, do your testing, and then the state's at Home Depot, doing their testing. I mean, obviously somebody's going to get paid on a per test basis probably. But so I'm just kind of curious if there's been any thought, as to, all of that. And I'm, because you got a lot of doctors involved here, a lot of them have lost an enormous amount of business, especially those that are, trying to do, what do they call it?
Elective surgery.
Surgeries that are optional, that Manatee Memorial now is shut down again. I could just see there's, at some point, maybe this money's going to dry up, and that's going to be a negative impact, to those people, because this virus, I believe, is going to be with us, like you say, for a long, long time. And, it's just, it could end up being expensive, and at what point are the citizens going to have to start, I've been tested, it's free. Hey, if it's free, it's for me. I get it. But, can that go on indefinitely?
I'm looking it up.
Jake, do you want to, what's the question?
Good afternoon, sir. This is Jennifer Bensi. In terms of the data collection, all of that is handled in Tallahassee. We are not doing that. Here at the local level, as I said, my team is doing testing, but a majority of our team is doing the contact tracing. We have usually 2 epidemiologists on staff right now. How many do we have now, Doctor?
7,
7 epidemiologists, and how many contact tracers?
16.
16, 24, not 24/7, but 7 days a week. And then the state also is contracted with companies to call the persons who are negative, so that our teams can focus on the positive. So we're not involved, if you will, in the data collection. We get the summary from Tallahassee by county, and then work with those numbers to make local determinations. Jake, I don't know if you want to add anything from the CARES perspective.
I think you did a very good job at explaining that. I am not aware of any money that's tied to the amount of tests that are done, that is tied to the amount of positives that you have either as well.
Madam Chair, I just Googled the diagnosis codes for COVID, and I know we have a lot of people out here and doctors, but there's 2 codes, one for confirmed and one for probable. And confirmed is RA01.0 and probable is RA01.1. So if anybody wants to look, it's public knowledge. They can look it up, and Medicare will tell you what their reimbursement rates is.
That's important.
Okay. Well, I don't know, Steve, if you got your answer, but you're right. It's going to cost a lot of money, and I will bet that every one of us will be at some point paying for this. That's just my guess, but you're the banker. If you got a better guess, or better yet, you can write a check. Let us know.
I don't think I want that task, but it's because it's going to be a huge number, and it's going to get bigger, and but we need to do it. It's really critical. I get it. I think we all get it. And but there is a cost involved in it, and let's just hope we can find the resources to fund all of it at the end of the day. So thank you very much again for all that you all have been doing.
Okay. Vanessa is the last person I have on the board,
Yeah.
and then we're going to take a 10-minute break.
And I'm ready for that 10-minute break. Just a couple of things. I guess the way it was, we were told originally that 34208 was where Manatee Memorial was, but now I'm hearing, oh, no, that's not it. It's wherever they now live. So I guess that changes everything. I don't know what you guys are telling all of your citizens, but I better.
There's a nursing home.
Figure out something.
34208, the highest one. River.
Is that what it is? I think there's 2 actually in
Yeah.
08, not just one.
Well, the
think
biggest
there's
one
2.
is right across
Yeah.
from Manatee.
And
So-
they
And
do
they live
live in the
there. They
nursing
live
home,
there.
so
Right,
that's
right.
what I was
Yeah.
told.
Right.
Yeah, and then the second thing is, I want to bring something up here that I think a lot of people would probably feel the same. We did lose a very good friend of Manatee County.
Two.
And words can't even really talk about it. But with all due respect to him and his family, we just don't throw out people's names. We show them respect. And I would ask that he and his family get the same respect today in this meeting that we show to others who have the virus or who have passed away, because the family's really suffering right now. And we don't need to be, we don't need to keep going there. That just helps to promote the agenda happening here today. And I just don't feel that it's appropriate. So I would really appreciate it. I'm sure the family would if that would not happen. Thank you.
All right, we're going to take a 10-minute break, and then we get to hear from the attorneys. So everybody get your caffeine, and we'll be ready to go.
especially the door. Oh, nice with the test 1, 2, 3, 4. Q&A mic 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Sorry, I won't use it. I'll use my knuckles like I did last time. Got it? Okay, good. We're going to reconvene at this point. I'm going to ask County Attorney Clegg to go through the
Resolution.
resolution.
Yes, ma'am. Is this all right? Can everyone hear me?
Little louder.
Okay, is that better?
Yeah.
All right. Madam Chair, just to walk through the resolution section by section, by way of background, as I'd stated last week, there are quite a few examples from around the state of mask requirements, but there isn't a lot of uniformity from jurisdiction to jurisdiction. They're really all over the place. As of last week, the only example that we had found that had been reviewed and upheld by the courts was a Leon County ordinance that I mentioned on Wednesday. It had been upheld only by a trial court, so that decision is not binding in Manatee County. So it may not be the best legal precedent, but it's the only one that we had as of the weekend. So we modeled this resolution after the Leon resolution, but we did make some changes to adapt it to the county, and I'll talk about those. We did find out today that there's been a decision out of Palm Beach to uphold their mask order, again by a trial court. And just in briefly looking at that order, they reference an earlier decision by an Alachua County court to uphold another mask order. So it appears that there have actually been a few legal decisions now upholding these types of orders, ordinances, resolutions. So looking at the document itself, I will start with the recitals and findings. These comprise 3.5 pages of a 6.5 page resolution, which seems like a lot, but that's a pattern that you will see in the executive orders and the local emergency orders throughout the COVID-19 health emergency, and it reflects the need to spell out the public health emergency that justifies the responses of the government. So that's why you see a lot of material in there. Much of what you see in there, this board has seen before in other contexts. The important thing to recognize is that beginning at the bottom of page 1, the resolution cites Chapter 252 of Florida statutes, which is the Emergency Management Act, as the basis and authority for the resolution. That's the same act that authorizes the state of emergency order, the curfew resolution the board adopted, the governor's executive orders. It is a broad law that deals with public emergencies, and it's going to be important when we talk about enforcement when we get to that part of the resolution. So then, turning to Section 2, definitions, there are 3 defined terms in the resolution: face coverings, business establishments, and lodging establishments. The term face coverings follows the CDC guidelines that are included in your supporting agenda materials. And from a legal standpoint, that is the strongest way to approach this issue, to follow the guidelines and the terminology used by the CDC. The term business establishment tells the public where the mask requirement applies, and it follows the Leon County model, and it's a very broad definition that covers virtually all places where there is interaction with the public. The board does have some latitude to change this if the board is of the mind to do so, but I do need to caution you that the further you move away from the Leon precedent, the less useful it is to us in citing it if we are challenged on this resolution. And I do need to caution you as well to be careful about not favoring any particular kind of speech or gatherings, opening you up to a suggestion that you've made content-based restrictions under the First Amendment. And then finally, lodging establishment is really just a definition mined from state law to cover hotels, motels, and other vacation rentals for the purpose of exempting them from the mask requirement. So then, turning to Section 3, the mandatory requirements section, which is on pages 5 and 6. This basically spells out the rule and the exceptions to the rule. And item 1 is very straightforward. Individuals and business establishments must wear face coverings unless they are subject to one of the exceptions. Paragraph 2 lists 6 of them. The most important one is A, and that's the social distancing exception. Basically, that says that even if they're in a business establishment, if they're maintaining social distancing, then they are exempt from wearing a face covering. That is different from the Leon County approach. The Leon County approach, there was only a very limited social distancing exception for exercising, working in private offices. So we changed that in this draft. A couple of lawyers flagged it in the office, quite honestly, because if we took the Leon County approach, sitting around this table right now, every one of us would have to wear a mask. And that's not been the approach that the county has taken, and that's not necessarily the approach we're seeing businesses take. So that's why we changed that. The other exceptions are modeled virtually word for word after Leon, and they're self-explanatory, but I can certainly answer any questions about them at the appropriate time. So then turning to Section 4, penalties and enforcement. We've gotten a lot of questions about this. This section explains to the public the consequences, or at least the potential consequences, of violating the resolution if they are cited. It follows the Leon model word for word, which is important because that's an example that survived legal challenge at the trial court level. Paragraph 1 limits violations to, basically says they are non-criminal infractions, which is like a traffic ticket. And it also says that they are not grounds for arrest, search, or seizure, which avoids a lot of potential civil rights issues and a lot of potential constitutional challenges to the resolution. This is a section we strongly recommend you keep in the resolution and take this approach. We think it certainly helped it to survive legal challenge in Leon, and we also think it avoids some of the concerns that some members of the public have about how this resolution could be used. The second paragraph provides for escalating fines and other remedies, and that, I mean, we've done the same thing. If there's a business that's flagrantly violating it, it gives us the right to seek an injunction against that business, those kinds of things. But you could change some of that, and it wouldn't cause us so much heartburn as if you were to try to change something in paragraph 1. This section is silent as to who does the enforcement, and some people have asked us about that. That is the practice for orders under the Emergency Management Act, unless you're bringing in code enforcement. For example, our curfew resolution worked the same way. Florida Statute 252.47 is a section of the Emergency Management Act, and it says that all orders issued under that act are enforceable by law enforcement authorities. And our own code of ordinances says the same thing. So the board should recognize this resolution as drafted is to be enforced by law enforcement. It cannot be enforced by code enforcement officers unless we amend our county code. So turning to Section 5, applicability, this is the section that addresses whether the resolution applies within cities. I recall at least one question from board members about this on Wednesday. By way of background, as the board is well aware because you deal with this from time to time, the Florida Constitution provides that as a non-charter county, we can adopt ordinances that apply within cities. The panhandling ordinance is a recent example. And so long as the city has not adopted a conflicting ordinance, that ordinance applies. But if the city adopts a conflicting ordinance, then it controls to the extent of a conflict. Under the Emergency Management Act, however, it's not so clear whether cities can opt out of a county order. There's some language in the statute that kind of makes that questionable. So, for example, the curfew resolution applied everywhere, but we specifically opted out the town of Longboat Key. The others we did not. They asked to be opted out so they could be under the jurisdiction strictly of Sarasota and not have to deal with two counties. The Leon ordinance and several other county orders apply countywide throughout, within cities and within unincorporated areas. Trying to anticipate how this board would want to handle this, we built in an opt-out provision into this resolution so that if a city has a policy, whether by resolution or ordinance, dealing with masks, and it doesn't necessarily have to conflict, it's actually more flexible than the Florida Constitution, then that policy within the city would supersede this, and this would have no effect. Some of them already have these in place, quite a few of them, so they would not be affected by this resolution. The board could change this in any number of ways if you decide you want to take a different approach. This is a pure policy decision. How do you want to interface with the municipalities? We just wrote it this way, trying to anticipate, how the board may want to deal with it. Section 6, severability, is, it's boilerplate. It's important to the lawyers, but it's not that important for the purpose of a policy debate. But Section 7, effective date and duration, is the way it's written now. The resolution takes effect immediately upon adoption, and it remains in place as long as the board continues to extend the state of emergency for COVID-19. Because this is being adopted under the Emergency Management Act, once that COVID-19 emergency goes away, this resolution has to go away. It's no longer legally defensible. You could repeal it earlier at any time in any board meeting. It just takes a majority vote to decide to repeal it. But unless you do that, it will remain in effect as long as you continue that COVID-19 state of emergency. You don't have to do it that way, but we thought that was the cleanest way to present it to you. So, in conclusion, the board does have some latitude to change things within this resolution within the limits of what is legally defensible. But as I said earlier, the further you go from the example that we relied on, the less useful it is to us in a legal challenge. And Madam Chair, with that, I'll be happy to answer any questions.
All right, questions for Mr. Clegg. Misty.
Thank you. I don't have a question for Bill, but I did think it was important as we talk about enforcement to let you know that I spoke with Sheriff Wells this afternoon right before coming here. And I told him I was going to relay his information to the public. So I asked him about this mask ordinance and how he felt, and he said he really doesn't like law enforcement being involved in health mandates because the manpower is so difficult. They barely have enough officers to manage what they're managing today. But with that said, he said, yes, he will respond when people call. He hopes that if there's an incident, let's say in a 7-Eleven, that someone's not wearing a mask, that the individual who notices will go to the manager and say, please, could you remind your customer that there is a mandatory mask ordinance? He hopes that that's how most of these issues will be worked out, and that most people will certainly comply, because they may have forgotten, or maybe they didn't have a mask. He said his officers are not going to get involved in yelling and screaming and confrontation, and they don't want to be difficult. In fact, they want to do the opposite. They want to help people. Okay, so he said his people, if they are called out, they will be respectful and they will be helpful, and they don't want to write tickets. They just want to help people comply. So I told him that I would share that information with the board.
Thank you. Kind of thought if he wanted to talk to me, he'd call me, so I hadn't heard, so appreciate that. All right, Carol?
I want to thank the sheriff. He's a really good guy and good sheriff, so I respect his thoughts totally. And my city has been doing this. They're a lot stricter than what we're doing, as you know. The first fine is $250, second is $500. And I live where people come from all over the United States, hopefully not the world, they're not supposed to be. But I checked, because we have a travel ban. But I have checked, and not one citation has been given yet. When businesses call because the customer's in there stressed out because somebody walks in without a mask, they say, hey, we got a law here, you have to wear a mask. And they've only ever had to talk to them. Nobody's gotten a ticket yet, and it's worked. I think we've gotten 10 or 20 times more emails for supporting this mask resolution, not ordinance, than we have against. I represent everybody. I know somehow this has gotten political, and it's a shame. It is a public safety, and I'm sorry for my friends that we don't see on this issue, and they have every right to feel like they do, and myself included. But there's sometimes you just don't all agree on issues, and you just still need to be respectful. So, but I'm still gonna. I support this. The fines look fine to me. I think Anna Maria is $25 the first time. I think this one said $50, correct? The first time?
I think it's 50, 125.
It's mainly to get people in compliance. I don't want to, I have no
Yeah.
problems with lowering that amount to the first offense to 25. That jives with Anna Maria. I'm not sure what Lombok Key does. Holmes Beach has, to me, gone way overboard, and I made that known to them, but they can do what they want. Lombok Key has an order, correct, Bill? Some
That
kind of
is
ordinance?
correct.
Is it a resolution or an ordinance?
I do not know, but I did receive an email from their council, a very courteous email today, indicating that they do have a policy in place.
And the city of Bradenton and Palmetto, do they have anything? I know Bradenton they asked the businesses to put a sign in, but would this fall under them since they didn't have a resolution, or did they have a resolution?
I do not know how they adopted it, but they would be exempt because they have addressed it through a policy. Now, Palmetto, I'm not sure where they are right now. The last report I saw was they were going to look at it again.
Okay,
So I don't know, but I know the city of Bradenton does have something in place.
okay, thank you.
In fact, I think it is an ordinance because their attorney was kind enough to send it to me. Now that I recall, it was an
Okay,
ordinance.
thanks.
Yes.
Okay, I just had a couple questions that came up in conversation with folks about this. So you'd mentioned exercising. Our resolution is silent. So if you're exercising, you would think you wouldn't need to wear a mask. I know
You're 6 feet away.
I breathe very heavily when I exercise. That's why I don't go to the gym now, even though I have a gym membership that I'm paying on every month and I don't use it. But
I can address that.
where are we at with exercising?
So-
It was a good question, I got.
Several of them included an exemption for exercising where you're 6 feet apart from everybody.
Holmes Beach.
And once we put the general exemption in for people to be socially distant, we didn't think it was necessary to put something in there that said the same thing about exercising. In other words, if you're 6 feet apart, regardless of what you're doing, exercising or anything else, you're exempt.
So you can go to the gym, and I guess I'm using it as an excuse. I haven't been to the gym since all of this has happened. that generally they're requiring 6 feet apart
They
at
are.
gyms?
Yeah, that's what it looks
Okay.
like. I mean,
So you don't think we need that specifically? Okay. And obviously, if you're running outside, you don't need this. Doesn't apply outside anyways, right?
that is
So if you're
correct.
running outside.
It does not apply outside. That's
Okay.
correct.
All right. Somebody asked me too, we had promised that we would give a warning if we were adopting such a thing. I'm reading the language,
It does not include that right now.
but it does say, prior to the issuance of a citation, the individual will be asked to comply with this emergency resolution or be able to explain how an exception in Section 3, subparagraph 2 applies to them.
Right.
So that might be construed as a warning, I guess is the way I looked at that. Or do we need to add specific language that says you'll get a warning?
You can if you're so inclined. Law enforcement often does that anyway.
Right.
That is within their discretion, but if the board wants to make sure the first time is always a warning, you could add that without it causing any legal problems.
Yeah, we should.
I would like to add that.
All
I'm
right.
seeing people that I know are going to vote for this nodding their heads, yes, that there be a warning added as a first. You know, and as the sheriff said, I mean, he does have much better things probably to do. But if we're going to do this, we've got to at least have a warning built in, is the way I feel about it.
And Madam Chair, I can craft that during public comment and incorporate that into the document.
All right. And then the last one I had, I don't know that we got an answer for this. So we adopt a mask ordinance, and it's running week to week with our emergency, but our numbers start coming down. That's a great thing.
Cancel it anytime.
Well, what if it's due to wearing a mask? Do we really say, oh, we can get rid of that mask ordinance now, our numbers are coming down? Well, do anybody have any idea about how we do get, we want this to be temporary, but how do we say, oh gosh, we don't need this anymore? Any thoughts from our professional folks?
Attorney.
Or the attorney?
It
whoever.
says you can cancel anytime.
The resolution can be repealed at any time.
Right.
If you're just going to rely on this, then you can do that at any board meeting.
Right.
Now, we have talked about coming behind it and putting in place an ordinance. We're going to take our time with that and see if we get a legal challenge first, because if we do, then we're going to want to address the issues in the legal challenge in the ordinance. So you've given us the authority to do it, but we're not going to be back here in 10 days saying adopt an ordinance. It would be harder to repeal an ordinance than a resolution because of the 10-day notice requirement. So we'll hold off on that, but right now, the way this is set up, you could repeal this at any board meeting, 4 votes.
So I guess I'll ask, and I appreciate that legality, but it's really a question of, you know, do we think that we're going to get to a point where we're going to say, you know, we've got this thing under control, we can get rid of them? I mean, people are going to ask me, and they ask me, and it's a good question. You know, is this going to be there for a long time? I don't know. If you guys have any thoughts on that issue.
Well, first thing is we are hoping for a vaccine when that comes, and for those who take it, that will help tremendously. The other issue is looking at other countries and other places where they've already been through this type of issue, and you have to wait. There's different models on how many days you wait of no new cases, for example, to truly say you've eliminated. And that's not going to happen in one county. We're not an island. But I think to look over the next month and see, because it's going to take 10 to 14 days to really start seeing any kind of change, and we hope we will see it. And then what does that look like 2 more weeks into it? So I think that at least 30 days to really see if there's any effect that's occurring because of it.
Okay. Reggie, and then Vanessa.
Actually, ladies first.
Well, I was just going to say that it seems to me that, you know, I think it's a great question, wanting to know when this is going to end. And I think the other thing that I've heard from residents, and I'm sure that you all have as well, is where does it stop? Where does it stop that this board isn't going to come forward again and say, wait a minute, we need another curfew? Or wait a minute, we might need to add property rights in there. And oh, wait a minute, now the mask isn't going to work. We need something over the eyes. I mean, you know, citizens want to know. And I think they deserve an answer. I like what Dr. Bency said, about 30 days, but I do want to remind this board that, I know we were talking about 2% before. Basically we were at like 5% as an average. So before. So I just think that this board needs to realize what you're doing and also not be so quick to want to keep it in force any longer than what you need to. Because the citizens aren't going to tolerate it but so long. Even those that right now are begging you for it. And don't let anybody tell you it's not political, because I've checked every single email. So, I don't know, but just keep that in mind, that, the citizens do deserve a positive response so that they have something to look forward to. If you're going to do this to them, then, you need to also let them know that maybe in 2 weeks you'll look at it again, or whatever the case, whatever y'all guys, whatever y'all decide. But, give them something positive to be able to lean on right now, too, because this is not an easy thing that y'all are looking at doing right now. Thank you.
Reggie and
Right, and I have two things on that, which is what I was kind of thinking earlier when I was saying, do we need to look at a goal that we're targeting for our county as far as a percent? But I think we addressed that and said that conversation comes back when we are at 5% or below. Now, I'm not saying that's what they said, but that's what we were kind of looking for so we can kind of gauge it and going. I think it's important to revisit the penalties of enforcement. When I talked to the sheriff on Friday at length, as well as talking to Mr. Clegg on Friday, I was very concerned about individuals that receiving potential citations, and the citations could lead into arrest and things of that nature. And we had a great dialogue with that, myself and Clegg and the sheriff. And it's not intent for someone to be cited and arrested and end up having more troubles, which is why the terminology in the resolution says it's a non-criminal infraction. Am I correct, Mr. Clegg?
Yes, sir.
Okay, and I think that's very, very important because when you start talking about civil liberties, sometimes that slide into a search and seizure. Next thing you have bigger issues, which is a concern with some of the individuals that I serve. We don't want this to lead into an area where someone ends up being arrested because they don't have on a mask. So to the public, within our penalties of enforcement, it's a non-criminal infraction, and it will not lead to arrest. And I even went as far as, what if they're on probation? And me and Mr. Clegg talked about that, which again, non-criminal infraction addresses that. More importantly, in my opinion, I'm not trying to go at anyone, it's just the importance of wearing the mask so we can make sure you protect yourself and your loved ones. I think we should put that warning in there. I think we should put it in there because what it does is opens up an opportunity for education and for potentially ease some communication relations, with law enforcement, and allow those type conversations to be easy instead of going directly in, we're going to cite you and lead to some other issues. So I'm in support of putting that warning in first.
Okay. Sherry wanted to say something, then Misty. Sherry?
Yeah, I just wanted to point the board back. I know we're struggling with this. What's the metric? But just remember, we've been initially we got ourselves into being targeted as not performing well because we were not able to meet some of the state metrics. So there are there's three areas. One of the main one is the downward trajectory. Initially, we were looking for a 14-day downward trajectory, and that was our goal when we were trying to get in line with the state back in the latter part of May. And we were able to do that by increasing the testing and by I believe, too, Dr. Bency has, is reaching out to a lot of underserved areas. So they're doing that on a daily basis with their mobile units. So, I think what the board needs to be comfortable with, and at least the public knowing that we're tracking all of that, we're tracking those 3 metrics so that we can stay in line with the governor's plan and that we're in line with the state. Whether you want to come up with a target or whether you want to just continue to track that, because we do provide that update at each meeting. That may not be the best answer for everyone watching, but for today, I think everyone needs to know that we track those metrics at every meeting, and our goal is for us to have that ongoing downward trajectory of the positive cases. And as was mentioned earlier, we're at over 18% of the population. As that continues, that's going to be helpful. But the second one that was not an issue in the early days and early weeks was the capability for treating patients and that robust testing. So we're tracking that for the board. We would say from Director Sauer's viewpoint and mine, we're going to bring that to the board every week. We have that information, and we should be able to hone in on some trends that will be starting to get you closer to seeing an impact. To do that today, I'm not sure that that's possible. You're just now considering the reasons to enact something like this, but we aren't just leaving it wide open. We're tracking all of those metrics.
Thank you. Misty?
Thank you for that, Sherry, and really great discussion with all of you. I appreciate it. I am in favor of the warning, very much so. Let's educate our people and help our people. There should be no reason to confront or punish right away. That's not my goal or any of our goals. Why not have the mask ordinance follow the state of emergency? That's what makes sense to me, but I would love to hear from the doctors if is there a number that we hit and then we celebrate and say we don't need masks anymore? I don't know, but as long as we're in a state of emergency, why not use this tool to keep the numbers as low as possible? I agree with Vanessa that this is a political issue, unfortunately. It's so sad that it's a political issue. It shouldn't be. This is public health. So when I think you said you looked at every email, and I guess you're saying that all or most were from Democrats. I don't know. I don't know exactly what you were trying to convey. But I will tell you that I have spoken with people of all parties. I have spoken with Republicans, Democrats, and no party affiliates. And they all, many of them, have their political angle, and I don't appreciate it because there's no politics in this for me. In fact, I was just a couple days ago over at a member of our REC giving that family masks because they're so afraid. So it is all parties. What's next? What are we going to require next? I have confidence that we're not going to require anything that is ridiculous or not well thought out. I know I'm not going to vote for anything that doesn't have medical data behind it that says it somehow makes our community better. I don't know what's next. I don't think anybody knows what's next. That's the scary thing, But I don't think we're going to take away liberties or develop mandates lightly, I'll tell you that. So what's next? I don't know. But I think that we just need to operate the best we can day to day to keep people safe. That's it. It's that simple.
Okay. All right. We're going to go to public comment now. It seems like forever. You guys have been very patient, but I'll tell you there's a ton of people signed up. So I take them in the order they're handed to me as I've been told. What?
There's one that you missed.
I know.
See it? Okay.
As I've been told, they are as they were signed in. So everybody will have 3 minutes. You're going to come to the podium. You're going to state your name for the record, and then after you're done, he's going to do a little cleanup. So we're going to try to keep this as safe as possible. We also have people that are calling in, so it could be a long afternoon. So, and feel free to say I agree with the last speaker if you do and want to move forward. That'd be great. Okay, first up, I have Joe Hendricks. Mr. Hendricks, Oh, you good boy, he's passing. I'm sorry, I didn't mean that derogatory. Thank you, Joe, I appreciate that. Linda Crapo? Ms. Crapo, please come to the podium, state your name for the record, and you will have 3 minutes.
My name is Linda Crepeau, and I am from Bradenton. I am a nurse, and I am so grateful to all of you. I won't name everybody for the sake of time. The reason I wanted to make a tiny little thing today was to do a little show and tell, and I would like to cite again this study that was from Florida University, Atlanta, Florida University, I think it's called.
Florida.
And they actually, it was on the screen there for a while, but what they did is they talked about if a person is maskless and they are on the street surrounded by people, if they should cough or sneeze or yell or sing loudly and be positive for COVID, their droplet nuclei may spread as far as 12 feet. If you have a cotton 2-layer mask, such as what I am wearing now, and I am positive, and I am doing all those things, singing, yelling, sneezing, coughing, 2 layers of cotton, 2.5 inches. That's as far as it goes. That is so significant. That's my comment. Thank you to everyone.
Thank you. Janet Mixon, which will be followed by Jeannie Smith. And there are dots, I believe, on the floor if you want to line up. You can line up 6 feet behind Mrs. Mixon as she speaks.
Hello, and I again also welcome. Thank you guys. You had great questions that answered a lot of questions for me. In our business, we do everything we can to try to keep people safe. We have the UVC ray. We bought a dozen of these that we use on our register. We use it. I mean, we can scan people's items when they purchase them. We do everything we can. We get the temperatures and to keep them safe. The thing is, you're scaring people. People are afraid. And the last time we ever had something like this was 9/11. And the country was petrified. And shortly after 9/11, Dean's wife passed away. And my husband's cancer metastasized. And the doctor told me that the stress and the fear that the country was under was exacerbating everybody's illnesses. And at the time, he said the hospitals are getting full because illnesses that you have inside, if you're stressed, which how could we not be, it's going to get worse. And an example of this is our nursing homes. I mean, 5 months ago, you closed the nursing homes so that they couldn't have family, they couldn't do their little meetings, they couldn't have field trips, they couldn't do anything, and the only people going in there have masks. And yet 2/3 of the people dying are in nursing homes. We're scaring these people to death. And you got to think about what would it be like for you if all you had was your TV and you're in your room for 5 months. And it's like we've got to think about what we're doing, even if it's the media or whatever, that we're scaring people. And I have my doctorate in child and youth studies, and I'm worried about the kids. The fact that 5 months ago, anybody wearing a mask was either going to rob you or take out your appendix. That's what they knew. They were, stranger danger stuff. And now everybody's wearing a mask. And part of childhood is the smile that you do that they acknowledge. When a child is eating an ice cream cone in our store, I always go out and go, whoa, you must have been a good girl. You got a big ice cream cone, and they're smiling. Their parents are saying, yeah, they're great. It's like they need that reinforcement of happiness, and we're taking that away. And if you think about it, 700,000 kids are abused every year. And the people that save them are their teachers. Their teachers look at their faces. The teachers but if you put a mask on a child and all you can see is his eyes, you can't tell what's happening to this child. And, it's going to be something that, you try to keep your kids away from the TV. I try to stay away from the TV. But they, it's like even in the grocery store when you see somebody with a child in a cart, you look at them and it's like, oh, that's a cute little one, and they're waving to you. These are things that we grew up with. This is the way we grew up.
Thank you. Your time is up, and we have lots of people. But that was really well done. I do want to say, though, we didn't shut down the nursing homes. We have nothing to do with the nursing home regulations. That's a state.
Sorry.
That's a state thing. So just clarify.
Yeah.
Thank you.
The state did.
Jeannie Smith to be followed by Stefan Gafante, I think. I got that right. Jeannie Smith to be followed by Stefan Gafante. Is Jeannie Smith here? I think maybe Jeannie might have had to leave, had something better to do.
Or she's in another room.
Or if she comes in, we will definitely let her speak if she's in another room and is taking some time. But I'm going to take Stefan to be followed by Sandra Greeley.
Thank you. I've got my wife had to leave, so you can take Maureen Gafante off your list.
Okay.
And she made me promise to hand this in, so who do I hand it into?
Right now. Right behind you.
Thank you. All right. I'm Dr. Gafante. Today I'd like to talk about the unprecedented and inappropriate response to this virus. In 2,500 years of medical history, we have never quarantined the healthy. Yet today, we have closed schools, businesses, and hospitals. At first, we were told it's only for a few weeks to flatten the curve, but it's gone on now for 5 months. Where in the Constitution does it say the government can decide which jobs are essential? Where does it say the government can decide which surgeries are essential and which aren't? Why is an abortion essential where cancer radiation not? Why are riots okay but church worship not? Why are businesses locked down but prisoners set free? Has anyone even brought up the fact that driving, a risk we have taken since we were 16, is 5 times more dangerous than the coronavirus? If you vote for this mask resolution, will you then walk home to protect the public? This spring, governors and other bureaucrats ordered schools closed. They were following our country's national strategy for pandemic influenza implementation plan. This plan was designed to respond to the 1918 Spanish flu, whose most vulnerable population were children. In contrast, COVID spares children and attacks the elderly. This is another example of the inappropriate response to this virus. Also, consider that the Spanish flu lasted 2 years. Do you think any small business can survive these chaotic rules for 2 years? Before you vote on this resolution, I want you to think from the medical perspective. First, are you treating the right disease? Maybe not. The death rate is plummeting. One of the reasons might be that the virus has mutated into what would be called COVID-20. Mutations tend to be milder. If so, extreme measures like requiring masks may be unnecessary. Next, is your treatment plan worse than the disease itself? As you kill small businesses, you create despair. Suicides, spousal abuse go up along with addiction and overdose. In all these months, have your staff brought you the data on the rise of suicides, abuse, and overdose? If not, I suggest you table this resolution until you know these answers. You may be killing more people than you know.
Thank you.
Last are your patients, which is the public. Are they fully informed? Do they know that the deaths are plummeting? The risk for COVID is 1/5 that of driving down the road.
Sir,
Do
your
they know
time is
that
up.
you are shifting the risk from those who are physically most vulnerable to those who are emotionally most vulnerable? And finally, do they know you may do this for the next 2 years, and any time may determine the need arises?
Thank you. I have Sandra Greeley. I don't know if Ms. Greeley has shown up. Kevin Wright to be followed by Joshua Barnett. I saw Joshua earlier. I don't know if he's still here.
They're all in the other rooms.
Good afternoon. I'm Kevin Wright. Last week, several of you seized upon the Leon County model to advance a county government solution to otherwise genuine health concerns, accepting the false narrative that that is the only answer. Having read the resolution, heard it explained, I applaud the departure from the Leon model, but I don't think that was absorbed by all the commissioners, and it certainly needs to be absorbed by the public. If I'm inside the 7-Eleven that you talked about, Misty, and I got 6 feet of distance, I'm exempt from the mask rule. That is something else that the public has got to be aware of, and I'm not sure that that was absorbed by everybody out here. I also applaud the opt-out. Bradenton does not have a mandatory mask policy. So I'm glad to see that Bradenton, our city, will not have to enforce that. They will opt out. Days ago, 4 major national retail chains ended their refusal to serve those who do not wear masks. They no longer wanted their employees and their customers to bear the burden of being the mask police. They tired of the sometimes violent altercations in their stores, usually directed at those peacefully not wearing a mask regardless of reason. This is the burden you desire to place on our local businesses and citizens. Our law enforcement and code enforcers, in this case just law enforcement since code enforcers can't do anything, they do not need the burden either, just like the sheriff said. They cannot and therefore will not enforce it, nor should they. Commissioner Survey says she thinks few will actually pay for the fine and that the real goal is education and in compliance. You do not need a resolution or an ordinance to educate. What is compliance? Voluntary as a result of education or coerced as a result of the empty threat of monetary penalty in an already stressed economic time? I would submit the resolution that you're voting on today is largely symbolic when you consider everything that your legal counsel taught you. We've done a lot just for symbolic reasons that does absolutely nothing. It certainly doesn't do what the lady that was up here talked about. If you cough and it goes 12 feet outside, it doesn't apply to outside. What she talked about is not relevant to the discussion. The bottom line is that as long as the government and this board have the room to do what they perceive to be in the best interest of the community, you will use that leeway to ensure that you are being seen as doing something to help people, from saving us from a virus to keeping us safe by writing tickets for not wearing a mask. There's no free lunch. You either cause economic and social mayhem or you make a few reasonable hygiene tweaks and life goes on, knowing that tens of thousands of people will die from the virus, just like 2.5 million people a year die in the U.S. from everything from STDs to non-COVID virus and bacteria. 100,000 a year in nursing homes alone from those bugs. That is CDC data. This is where lovers of liberty fall short. We talk about boring topics like less regulation, lower taxes, smaller government. And the left, and you talk about emotionally motivating topics like it's just a mask, wear it. Are you selfish? COVID kills. Emotions drive most people's behavior most of the time. In fact, I would say that your response earlier to Commissioner Johnson, when you said, I will answer in 2 words, Valerie Tibbetts, that was a deplorable use of emotion.
Goodbye. Thank you. You are done. Thank you. Joshua Barnett is up next. Sir, your time is done.
Thank you very much.
Everyone is signed up. Thank you. Joshua Barnett to be followed by Joanne Abnar. And
He's got my vote.
I'm sorry. Jelani, that's an L. Doesn't look like it. Jelani, okay. Joshua first, and then Jelani.
Can't hear you at
Services
all.
Manager.
There we go.
What?
Healthcare Services Manager Joshua Barnett.
Thank you.
I'm here simply as a formality as your liaison to your appointed Healthcare Advisory Board. Under the Healthcare Advisory Board, there's in the resolution, it speaks to addressing health impacts and health quality for Manatee County. On June 25th, your board submitted a memo to recommend the adoption of face masks while in grocery stores and pharmacies and considers other public spaces at the board's discretion. At their latest meeting last week, they nominated Joanne Jones-Abnar to speak to you before on this particular issue. That's all I have. Thank you.
Okay. Thank you. Ms. Abnar, please come forward. State your name. After she cleans, I'm sorry. Don't forget about the great job she's doing.
Thank you so much for this opportunity to speak to you. As a member of the Health Care Advisory Board, we want you to know that members have been working hand in hand in the communities of color, the black and brown community, impoverished communities, homeless communities, people with mental health issue, and low-income communities as well. What we've been doing while we've been on the ground, we've been holding food drives where we fed over 2,000 families last week. We're working with doctors like Dr. Lisa Merrick in the Multicultural Health Institute, where they've been hands-on from the very beginning in this pandemic, and other medical people in the medical field like Centerstone. Some members have taken the Johns Hopkins care tracking course, and we have given community resources to the community at Bay that we know of, where we're giving them phones, we're getting them email addresses so that they can find out what the real situation is, and they can find out the truth, because a lot of them don't know what it is. We have distributed over 6,000 factory and handmade face masks to those with greater risk for health conditions like cardiovascular conditions like diabetes, bone disease, liver disease, and some kinds of cancer. Now, with the COVID-19, we have a novel virus that spreads rapidly and easily, and the full spectrum of the symptoms and health effects is only just beginning to be categorized, much less understood. And in the highest cases of 18% can be found in the age group of 25 to 34 in Manatee County. The old narrative that the COVID-19 is only significant for the older people are no longer real. It's no longer true. And this data that I'm giving you came from Manatee Health Institute, where they go around every week and they get the actual numbers, just like they do here from the state, and they also actually go to the locations that are doing the actual testing. Just this, from July 13th to the 20th, cases have increased in Manatee County by 27.6% in ages 14 to 24. From every 1,000 children in Manatee that have been tested, 13% are testing positive. These are just the people who have actually been tested. And in Manatee, 45 of the positive cases have no known race data and no known ethnicity, because they're not collecting that data. And with that not being done, it's very hard to get an actual number on the cases that's being affected by the younger people. The disease has not been around for years. It's basically just 6 months. No one knows yet how long the health effects and how many may present itself in years down the road, like AIDS and the measles and chickenpox. These are things that have been in the, we have done research on. But what we literally don't know is what we don't know. But what we do know, we should be smart enough to be able to eliminate the spread by doing things like frequent hand washing, physical distancing, reducing social and public contact, wearing masks, covering your cough and sneezes.
Thank you.
We know this. So these are things that we need to take into consideration. So I ask that you do pass this that we can do this, okay?
Thank you so much. David Clement, to be followed by Joanne Clement.
Thank you, Madam Chair and honorable commissioners. My name is David Clement. I'm a 45-year resident of Manatee County. Since I spoke to you Wednesday, I won't repeat myself with those comments, but if, with your grace, I would like to read a statement a friend of mine who can't be here asked me if I would. She is a medical doctor, lives in East Manatee, and she is a physician scientist, emeritus professor from Medical College of Wisconsin. The argument that, quote, no one knows what to do because the recommendations from CDC have changed, unquote, is invalid. As the science advances, we must follow the science and update recommendations accordingly. Before the benefit of seatbelts was shown, they weren't required. People resisted. Now they're required to protect the public health, and you can be cited for failure to wear one. Before cigarettes were shown to cause cancer, they were banned they were not banned or in restaurants, buildings, or planes, and people resisted these bans. Now cigarettes are restricted to protect the public health. Before COVID-19, masks were worn in hospitals predominantly to protect patients from infections that could be transmitted by healthcare workers. Only specially fitted N95 masks were thought to protect healthcare workers from dangerous viral infections transmitted by patients. The science has now shown that universal masking does, in fact, reduce the transmission of COVID-19. Even homemade cloth masks appear to do so. There is no evidence of scientific principles that would support claims that masks increase risks to the wearer of infections, inadequate oxygen, or too much carbon dioxide. No scientific evidence. COVID-19 is not a hoax. It's a severe viral disease that causes not only death but serious illness in 15 to 20% of those who contract it. Although the overall average wages for mortality appears to be approximately 1%. In those over 65, like myself, it's over 20%. And not enough time has passed to determine the long-term consequences of this disease. If the public does not act, this pandemic will continue unabated and more thousands will die. Hundreds of thousands will become seriously ill, and the economy will continue in recession, if not depression. Wearing a mask is a simple thing. People will resist, but masks must be required to protect the public health and preserve the economy.
Thank you.
This is the end of the statement from my friend, but I would like to add my personal comment to look at all the unmasked people in this room. You distributed these requests on every seat asking people to wear masks.
Thank you.
Many of them did not. But I bet not one of them came into this room smoking a cigarette or smoked in the building.
Sir, your time is done.
That's because we realized the harm of smoking and passed laws.
Please.
That's what we need to do today.
Thank you.
Thank you.
Joanne Clementis, to be followed by Marie Morel. I said that right? And then after Marie is Dr. Cassandra Hafner. If you are in this room or the next room, after Marie, Dr. Cassandra Hafner.
My comments are going to be very different from everything else you've heard today. No more figures, no more percentages. This is more about the culture that is what is happening to us with this disease that I notice. I am a sociologist by background. So you're going to think I may be off target, but there is a point to this. My grandfather worked in the West Virginia coal mines after the 5th grade. My father was the first in his family to attend college. He later attended University of Virginia for a master's degree and moved to the Big Apple to see the world. That was his dream. He loved the big bands and couldn't wait to see them in person. When World War II broke out, he abandoned those dreams. He tried to join the Army. He did not hear back. He telegraphed the Secretary of Defense. That is how important he felt it was to represent his country. That is what Americans do. They defend our country for all of us, not just for themselves. When my father was struck with lung cancer, he was a member of 5 volunteer organizations. He was instrumental in convincing Manatee County government to preserve the Powell Crosley estate for the enjoyment of all of us. His name is on a plaque somewhere on the property. He did these projects for all of us, not just for himself. This is what Americans do. My college sweetheart joined the Marine Officer Candidate School in 1966 at the age of 21, just graduating from college. He was told 50% of his officer candidate class would not come back. Of the 50% who returned, a majority would be seriously injured. The common knowledge was the Viet Cong covered bamboo stakes with feces, placing them in the ground for the American soldiers to step in, resulting in horrific infections. He didn't back down and say, "Oh, I'm not going." That's what Americans did. When my husband and I were both working full-time with 2 active school-age kids, we volunteered to adopt a Cambodian family fleeing the killing fields. We assumed we'd get a family, 4 or 5 people. To our surprise, we received a family of 10. Our church family quickly joined us in finding housing, arranging transportation, tutoring classes, etc. Those church members did not look the other way. They jumped in with great enthusiasm. This is what Americans do. We offer shelter to the innocents of the world, and people pitch in. I know there are many people in this room whose families have done the same thing throughout their lives. This is what Americans do. I am missing this lack of cooperation and feeling that we're all in this together. I was outside with my sign of what my point of view was. When someone came up without a sign or an opposing sign, I said, "Good afternoon," and they gave me a dirty look. In discussing patients who require ventilators, this is changing topics about, oh, the COVID is not that bad. This is going to make your hair stand up. A Georgetown University physician said, "It breaks my heart that Americans who become sick enough to need ventilators will not know what desperate situations they face in using a ventilator."
Thank you. I'm sorry, your time is done.
My last sentence, you have to have your hands tied down when you are sedated with a ventilator.
Thank you. Thank you. Marie Morell, to be followed by Dr. Cassandra Hafner, to be followed by Sonia Davidson.
Hi, I'm Marie Moriali. There's a big difference between recommending that people should wear a mask versus the government ordering people to do so. Healthy people wanting to breathe normally should not be considered a crime or fined. The metrics that are important are hospitalizations and mortality. So if we look at the data from the Florida Department of Health on the COVID dashboard, there's 154 COVID deaths in Manatee County out of 403,000 individuals. That is 0.04%, a very low percentage. If we look at hospitalizations, again, out of the 403,000 residents, there's 473 hospitalizations, which is 0.12%. Less than 2% of Manatee residents have actually tested positive for COVID based on your statistics. And of those, based on mortality rates, there is a 98% survival rate of people with COVID. Florida has a population of nearly 21.5 million people with less than 6,000 COVID deaths. That rate is 0.03%. And the survival rate of Florida residents, about 2% have tested positive for COVID. Their survival rate is 98.5%. The CDC vital statistics on their website show the U.S. is now at the bottom end of the bell curve for COVID mortality. Peak mortality was in mid-April. There's been a steady weekly decline since then. At the height of the pandemic, we were told that due to the science, masks did not work. The science has not changed. The data for testing has been faulty. Tests early on were found to be contaminated. Tests have been revoked from the FDA for emergency use authorization. And Advent Health up in Tampa had to rescind 33,000 of their tests because they were found to be inaccurate. A recent CDC research study from May 2020 analyzed 14 randomized controlled trials, which are the gold standard in research. They concluded that non-pharmaceutical measures in the community, such as masks, quote, did not support a substantial effort on transmission of laboratory-confirmed influenza, unquote. The New England Journal of Medicine in May 2020 said, quote, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infections. Masks can cause harm to the wearer by being warm and moist. They can trap viruses. They can become a breeding ground for bacteria and fungus and can lead to severe respiratory disease. And we know that people don't wear masks correctly and they reuse them. They put them under their nose, their chin. They constantly adjust them. The germs get on their hand, and that becomes contact transmission, which increases transmission rate. Lastly, the FDA states that, quote, face masks, end quote, are considered, quote, devices, end quote, when they are intended for use, quote, in the cure, mitigation, treatment, or prevention of disease. If you're advocating for a mask mandate to prevent the spread of COVID, you're dispensing medical advice and recommending the use of health devices such as cloth masks that are not authorized by the FDA. Why are you considering 100% of the community to be sick when 98% of us will not be getting this disease?
Thank you. Thank you. Your time is up. Thank you, ma'am. We have Dr. Cassandra Hafner to be followed by Sonia Davidson.
Hello, Commissioners. As a registered Republican voter of this county,
and a physician, I have become disheartened to see what is most definitely a public health issue become twisted into a political one, often by members of my own party. Last week, you were given a letter in support of a countywide mask mandate by the Manatee County Medical Society. Briefly, we stated in that letter, at a population level, masks are undeniably useful at reducing cases of COVID-19 in our community. Mask usage is most effective when all persons wear them. Persons who choose not to wear masks endanger others by risking asymptomatic or pre-symptomatic spread of the virus. Mandating masks in Manatee County will, 1, prevent spread of viral infection that will compromise the health of our citizens. 2, reduce outbreaks that will threaten business and school closures. 3, prevent unnecessary time off from work for employees and organizations. 4, save healthcare resources of our medical practices, which will be tasked with testing to clear persons for return to work and school. This letter was signed by 114 practicing physicians in Manatee County. This includes the ER doctors, the internists, the intensivists, and the infectious disease doctors that will be responsible for taking care of me, you, or anybody in this building should we contract COVID-19. Our hospitals are full, our ICUs are full. Somebody earlier asked about remdesivir. We have no remdesivir. The week before last, we were given 3 doses. Gilead recommends a 10-day dose of remdesivir. We cut that dose into 5 days in order to spread it across more people. Somebody also asked about plasma. I have not been able to get any of my patients plasma. I do have a colleague that a few days ago was able to get her patient plasma. In addition to these novel things that we don't expect to have in great quantities, even Decadron, a steroid that has been shown to greatly help lessen the burden of disease, the pharmacies are paging me saying we are running low on Decadron, and is my patient sick enough to give this person Decadron? Cough syrup, the strong cough syrup that we're able to give these really sick patients. Things like cough syrup, we are low on. Things are dire in the hospitals, and I'm not sure that you all appreciate that. We're rationing our ICU bed spaces, so patients that have major heart attacks, brain bleeds, things that would traditionally go into the ICU are not going into the ICU right now because there is no space. Those patients are going into floor beds. So while it may say Manatee County has 3 ICU beds available, that's because we are saving and rationing those ICU beds at this time. You've been forced to make many difficult decisions in the past few months. Unfortunately, most of your decisions have potential for great downside. We feel like this is not a decision that has great downside and has a very significant impact. Because is my time up?
Your time is up.
I was going to say something about the death certificates because it seems like there's a lot of confusion about that. Do you want me to comment on that?
All right, I'll give you a minute to comment.
Okay. So the vast majority of deaths do not go to the medical examiner, and it seems like there's some confusion with that. It's us, the primary care doctors, it's the ER doctors, the intensivists. We sign the death certificates. And if COVID-19 is directly responsible for that patient's death, COVID-19 will be listed as a cause of death, either number 1, number 2, number 3. I recently had an elderly lady fall and hit her head. She had a brain bleed because she was from a nursing home. She was tested and found to be positive. That had nothing to do with why she died. I did not list that as a cause of death. So people that happen to have COVID are not listed as dying of COVID if they died of something else. So
thank you.
It's us that do that.
Thank you. Sonia Davidson to be followed by Mary Ann Jensen. Sonia Davidson, Mary Ann Jensen, Joseph Leitenberger. Any of those folks here or next door? In the next room. Okay. We'll wait for Mary Ann to come on over. And thank you. Hello, Miss Mary Ann. Come to the podium. And if Sonia Davidson is here, she can come line up, or Joseph Leitenberger can sign up.
Once again, thank you, County Commissioners and Madam Chair. I was here to speak with you Wednesday, and we sort of discussed at that time the problem at the hospitals and how we preferred, I'm not at the hospital, but from colleagues and friends, they prefer not to have lunch. They prefer to have you wear your masks because they're tired and they want to go home. I will speak now as a school nurse for almost 40 years. Matter of fact, I retired for the second time just in May, but because I'm too old to go on the campus. They won't allow me on the campus anymore. But I've been a school nurse in this county for a long time, and we would like you to wear your mask so that we can get those children back safely to school. Yes, we want them in school, and the masks are not going to scare them. You see my mask? It has Minnie Mouse. Years ago, we changed our tops from white to all colors. I have a Halloween, I have a Valentine. We do not scare our kids. So please, we need to get that down. Please wear your masks. We want the kids back, but we want them back safely and our teachers back safely. Thank you. Please vote for this. Thank you.
Thank you. Joseph Leitenberger is to be followed up by Bob Quam, I think. Maybe. Joseph Leitenberger, followed by Bob Duam or Quam. I don't know if that's a Q or a D. Sorry. Please.
Yes, ma'am. My name is Joseph Leitenberger. I grew up here. I worked for the Sheriff's Department for 27 years. I'm a disabled Army veteran, and what this mask mandate, whatever you want to call it, is doing to the county and to the people that work here and live here is utterly insane. I got followed through Publix parking lot the other day out in Parrish. I have a mask with me. If it's required to get into the building, I follow the rules that are necessary, like the majority of people I know. I'm reaching into my pocket to get it. She's yelling at me from across the street. Do you want a mask? She's got a bag of them. I would suggest, since I'm on whatever, that you not take something like that from somebody in the street, that you get it through a reputable person. But she followed me to the door. When I turned around, she was standing closer to me than I am the microphone, telling me what an awful individual I was because I was not saving people. I don't understand. I did explain to her that if she was at least 6 feet away, that is required, that would probably be part of the problem, because I did have the mask on at that point because I was getting ready to go in the door. I didn't sign up to speak originally, but standing out front, as I was waiting to get in, they opened the door and they told us to stand 6 feet apart. We were standing in the group that we had, we packed up. Some of the folks here, some of the people that have spoken with their masks on, came up behind the back of me as close as I am to this microphone. The mask is not the save-all. Some of the commissioners have put the mask on when they're speaking. Some of them have taken them off. Some of them had gone to the Van Gogh style, hanging it off the one ear. And one commissioner even had it in her mouth as I watched from the other room. If we're going to employ a rule for everybody, I think that it should apply to everybody. One other thing, when you pass this, and with the sheriff's department or with the police departments, they're going to pick up the phone and call 911. Okay? My friends that I work with my whole life, they have a lot of other things that are more detrimental than somebody not having a mask. Not that it's not important. That's not what I'm saying. But somebody running to Publix or Winn-Dixie or wherever else to get a mask bandit is taking somebody away from something else that somebody else in your family may need. That's all I have to say. Thank you.
Thank you. Bob Quam, I think, followed by Jennifer Bales.
Quam. Bob Quam.
I got it right. That's a Q.
Appreciate it, Madam Chairman and other county commissioners and staff, et cetera. I'm a former hospital administrator, was one for years and years. I was in the psychiatric field and not in the general hospitals. But I retired just before the virus hit and have talked to many of my colleagues since then, and all of them to a person immediately started requiring masks for staff because they found out very quickly that the ones where our patients were getting infected was obviously coming from the staff coming in, and also major restrictions on visitors. I propose support of the ordinance, and one of the reasons being is that I've got a wife who works in a medical clinic, and they wear a mask. They try to get patients coming in to wear the mask, but they are not the policemen. The staff in these medical clinics, especially the medical clinics, they're not the police person. I don't expect with the ordinance passing that the Sheriff's Department's going to come in and drag somebody out. But the point is, with the ordinance, it gives the staff in these medical clinics a little bit more teeth relative to saying, hey, you guys need to wear a mask before we can treat you. So with that, I thank you for your support. Appreciate it.
Thank you. Jennifer Bales to be followed by Myra Langlois. Jennifer with the absolutely adorable dog.
Thank you. He's my salvation.
Mhm.
I keep hearing everybody talk about the 2% that keep dying and getting infected, and I think it's horrible. I do. But there's a big number that almost everyone I have met and heard speak today has missed out on. That's the 33% of people like me with ADA, with all list of numbers and all these problems that we live with every day. But when I show up to pick up my prescription or go to my doctor's office, I'm forced to wear a mask, and if I'm not, I'm assaulted by those who think I'm out killing everyone because I don't believe in the same fear that they do. But most of you forget that you can't step in my shoes and know why I can't wear a mask, why I have the right to be able to be healthy too, go to the grocery store and not be assaulted, and people screaming at me. I'm frustrated that so many people, you are so concerned with more of the 2% instead of the other 35% that grows every day with people who have to speak by sign language, who have all these other issues that none of you seem to be hitting. You're just talking about the 2%ers, but you forget about all the rest of us on the other side. I lost 3 relatives this year, my dad being one of them, who couldn't even get treatment because the country was shut down out of fear of a virus for 2% of the population. My dad counted. My daughter committed suicide. Her life counted. But you're not counting any of those people that are committing suicide every day. And the numbers grow because we constantly put out the fear. We're almost at herd immunity. But I don't see any of you concerned with my life or my children or my family or the majority of other people that are hurting every day. You just keep talking about the 2%. And we all got to wear a face mask. You might as well write me a ticket now because I'm not doing it. Not going to happen. Nor will my children, my grandchildren, and the rest of my family and friends. You can't scare me with your fear. I have common sense. Not one person in this group today has really acknowledged the other percentage of the people that you leave out every day. I work with children. They don't want to see me wearing a mask. I'm dealing with children with trauma who've been traumatized. They know me through my face. I'm not going to show fear. They should be able to look in my eyes and look in my face and know I understand. Or the rape victims every day that you're forcing with these stupid face mask mandates. Who are you to tell me what I have to do with my body until you start looking at the overall? The junk food, the crap we feed our kids. You'll close down the country, but you'll leave open the Burger King. You'll leave open the McDonald's. I don't get it. And until some of y'all start stepping up, I have no respect for it. You've lost me on my vote, and I can't wait to the next election.
Thank you. We're going to have Myra Langlois, Audra Griffin, followed by Debbie Clark.
Andrew Griffin. I had a whole different kind of speech, but after we brought doctors in here, I want to clarify quite a few things. We had several people say that there is no monetary value in these COVID deaths because of Medicare billing and whatever. Let's talk about that. Because for pneumonia, you guys get from Medicare $5,000. If pneumonia is classified as COVID pneumonia, you get $13,000. If those people go on ventilators, you get $39,000. And then if they die from that ventilator, you get another $132,000. Every single lab that's testing people is getting $100 for those. So let's not say that there's no incentive for this virus. There is absolutely a lot of incentive. And in this county right now, so far, $42 million has been flooded into this county from our federal government for these deaths. So yeah, maybe some doctors, like that lady that was just here, might be being responsible in classifying those that aren't with COVID versus from COVID, but there's a lot of incentive to have those death certificates say COVID. So with that being said, I want to get to the executive order, or the resolution order. The resolution is saying that they don't want you using this kind of mask. They want you to use this kind of mask. So let's talk about studies that nobody wants to bring up. Because according to CDC, from 1946 to July 24th, 2018, they studied millions of these masks. Millions. And this didn't stop the influenza, but it's supposed to stop COVID. Okay? Let's go to another study that was done with 1,600 hospital employees. The rate of infection of outcome was the highest in cloth masks. The laboratory says that the risk of infection, self-contamination, went up 95% from this. And we were told to wear masks for, I think, 2 days, you said, would be okay? Our masks are infected within 30 minutes or 30 seconds of us going into a store, touching something, and then having to move that mask to adjust it on our nose. So with this mask, not only are we now, I don't touch my face. You put a mask on me, my hands are on my face all day long. You're saying this stuff is going through our nose and mouth. What happens if I have an itch? I got to get up under there and itch. My hands are contaminated. I'm contaminating myself. And nobody wants to speak of this self-contamination. This study concludes that cloth masks and the results cautioned against the use of cloth masks. This is an important finding to inform occupational health and safety because of moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection.
Thank you. Next up, I have Debbie Clark to be followed by Glenn Gibolina.
Hey, Debbie Clark here. Got to say something to you all. Heart to heart, face to face. And I'm praying to our Lord God through Jesus Christ that he will give us wisdom in this. Because he says in his word, he gives very generously when we ask for wisdom. I happen to know, sadly, that there's those among you who will not change their minds. They're going to vote for this mandate, which is a complete affront to our freedoms. And just like Jennifer said earlier, for a 2%. And the heck with the rest of us. You know what? Dig deep, people. When you place this vote, there's going to be consequences. If you vote for a mandate of mask, be prepared. These people have stuck around while everybody burned up, 3 hours of time before we were able to speak, the public. And you know what? I sadly believe that it's not going to matter what we feel, the public, what we think, what we say. You've all made up your minds. So I just want to ask you and plead with you to just search your souls, people, and understand. This is about the 98% of the healthy people. And you know what? There is an immune building. There's things that we do to build our immunity. And by getting behind this with all the infections and everything, and the breathing problems and asthmatic people like me with missing a half a right lung, I can't breathe behind those. So I'm going to be forced, like so many others out there, to be harassed, given the stink eye every time I get out of my car and go into a store to shop. This is not what America is about, okay? Can we please just dial it down, the fear? God has not given us a spirit of fear, but of power, love, and a sound mind. People, please, I implore you. Thank you.
Thank you. All right. Glenn, you're up next. Please line up if you can. Be followed by Julia McLaughlin. Be followed by...
Elena, thank you very much. I'm a numbers guy. I like what I heard on the percentages. Here's one. You take 5,800 people that died, divided by 21 million citizens. That's the percentage. We lost 61,000 people by the flu 2 years ago, 5 times as many, and you guys didn't bat an eye. All of a sudden, now you want to infringe on the numbers. It's insane. Let's talk about the resolution. I sent you all a copy of this. I thought perhaps I'd read it for the record. Whereas cloth face recovery relatively inexpensive and readily available. Tell that to the unemployed who's about to lose those benefits, have to dig in their pocket for a mask. All right? Whereas the county intends to make face coverings available to the public. If you're going to socialize our county, then the county should provide 411,000 masks every week this is in effect. The county should join Amazon Prime for next day delivery. And by the way, where are those 400,000 cloth mats you got? I should have got one in the mail. Are you just saving them in bulk? If you got them, give them out. I don't see that happening. Mandatory requirements on businesses. Are you going to provide free of charge every employee on a daily basis? If you're forcing businesses to comply, then you should provide the mask. Why is it the business owner's responsibility to carry this expense? And that goes along with the lodging. What about the hotels and motels? Are you going to provide masks to the maids that are in those rooms every day? If anybody needs it, they do. You put that burden on small businesses, and that's not the normal cost of doing business. Signage. Let's talk about signage. You say nothing about signage. Are you going to provide that? Probably not. Let's just throw that on the old business owner.
No, we are.
Steve brought this out. The numbers are going down. Enter that into the record. If you can pick up this week's of North River News by Dr. Helver, please. Masks help make and keep America afraid. And that's exactly what you're doing. It says here, keep them wearing and practicing the symbols of fear. Mask, distancing, partially closed churches and small groups, consistent reminder that emergency is present and ongoing. The best next thing is to keep children from returning to school. That exists no science in keeping children out of school, and the benefit does not matter, nor virtually all Europe has opened its classrooms. Fear. You're basing this resolution on fear. It's unconstitutional. Quite frankly, it doesn't affect me. I'm not going to comply. I'll just go to Detweiler's, we don't need masks, and I'll go to Popey's in Palmetto where I had breakfast this morning. They got social distance table. I'm fine, about the only 2 places I go. But you're running this on fear. I'm running this all into the record.
Thank you.
Madam
Yes.
Chairman, for Board of Records, if anyone's reading off of any papers, they need to leave a copy.
You need to leave a copy, Glenn.
I think he did.
Thank you.
you.
Yeah,
Thank you.
You sent it via email too. Julia McLaughlin to be followed by Maureen. Actually, I think Maureen Gafati left, right? Her husband said. All right, so Julia to be followed by Sherry West. You are. I saw your name. Just a little bit down the stack. So Julia McLaughlin, is Miss McLaughlin in the house? All right, I know Maureen is not here. Sherry West, is Sherry West here? And again, we'll make sure that if they're taking their time to get over here. Art Cohen. Art Cohen to be followed by John Hawkinson. Okay.
Hello, everybody. My name is Art Cohen. I've been a resident of this county since 1978. I've been a practicing physician here since 1978. I'm past chief of staff at Blake Medical Center. I've worked in trauma centers, ERs. I've lived overseas. I currently am the medical director for Turning Points. We are the largest NGO providing free health care in the county. I'm here to speak on behalf of the mask. And I'm not going to throw any numbers out. There is something called observational epidemiology, which is how epidemiology started, and that's what this argument is about. What do the masks do? And frankly, I hate the mask. I don't like the idea of it. And when you start talking about the 98%, I'm one of the 98%. I don't have COVID. Haven't lost a lung. My friends' grandkids are also part of the 98% who do not have the disease. And what we're trying to do with the mask is decrease the risk of spread of this disease. I know at my clinic, we and Dr. Bensi knows this, we check everybody at the door, temperatures and history. We provide masks for everybody. We have masks for our volunteers. We have masks for our patients. We have masks for our providers. We have found that's controlled it. I would say when you look at the incidence of cases in the county, if the incidence is 11%, I could argue there are at least 40,000 other people in the county who are carrying the disease asymptomatically or with symptoms. So I regard the mask as a way of protecting myself, my patients. Second, I'm an attorney, and I always find this interesting when people start talking about constitutionality. There's the 10th Amendment, which I think gives the states the right to pass and quarantine people. There's the U.S. Constitution that gives health, safety, and welfare as the purview of the states. And I think if one looks at the pandemic of 1918 in the United States, where 676,000 people died, that some of the quarantine that took effect actually limited the effects of that disease. We're dealing with a moving target. You all want statistics, you want assurances, you want guidelines. Every day I go into the clinic, I speak to my co-manager, Dr. Kim Sand, I speak to my new CEO, I speak to our dentist, I speak to our volunteers, I speak to our social services division, and we come up with a game plan for the day. And that's my recommendation to you. You need the mask because you want to protect those other people. I'm cognizant of the fact that businesses are having a hard time, but the stressors on the hospitals, the stressors on the providers, the nurses, the stressors on the police, the fire department, the people who keep our county running. When you start talking about public health, and that's what this is, every measure you take in this county is for public health. It's why we have clean water, we have sewers, we have health care. And for all of you who don't like the mask and say it's unconstitutional and you should have a right to do whatever you want to do, I would say I have a constitutional right to be free of the threat of you infecting me, my grandkids, or my friends.
Thank you, sir.
And that's the 98% who believe that. Thank you.
Thanks, Dr. Thank you. John Hawkinson, be followed by Carol, Ciarniello.
Poor Betsy, you're
Guys have some great names, but Hawkinson,
a lot of
Carol
Italian.
Ciarniello.
Hi there, my name's John Hokinson. I'm a resident of Manatee County, and I want to thank the Madam Chairwoman and the county commissioners for allowing me to speak. I own a business in the county. I own a business in Sarasota County. I own a business in Charlotte County. I have a business that's under mask mandate in Sarasota County in the city, and I am abiding by that. When this started, 126 days ago under lockdown, I have worked every day in my restaurants because my people have to work. They have to go to work because they have to get paid. So if I hid in my house and watched them go to work, who would I be? So what did I do? When OSHA said I could take their temperatures, I took their temperatures every day right from the very first day. When we had masks, I supply all the PPE for my employees. I spend thousands of dollars a month on sanitizer, masks. It's staggering, the costs. So the comment was made that this is political reasons. There's no political reasons before I'm standing here to you today. The reason I have come to you is I look around this room, there are deputies wearing face shields, there are county commissioners wearing face shields, there are people wearing gaiters, there are officers in here wearing gaiters, which are just nylon. And, you know, we've heard people say the efficiency of these things. I really don't care if you wear this. I don't care if you wear this. I don't care if you wear this. But my employees, when they're in these, they are suffering. When they're in these, at least they can get by their day because they are stressed every day of the week, and it makes me cry. Because I know I can walk out and say, hey guys, I got to go somewhere. And I can take my mask off and go, thank God. You know, get the 6 feet away. But there are people that work every day in this county that don't get to have that privilege. And you are the only people that can make the change. So what I'm asking you to do is to make the change to the ordinance, which is the same ordinance that was just amended in the city of Sarasota, which is the same ordinance which was passed in Palm Beach County, which allows face shields, which allows any type of covering. And I will tell you, just like you received in my email earlier, I do not care if you come in with a paper bag on your head. If you just cover, it would make a huge difference to everyone. Thank you for your time, and I appreciate you.
Thank you. All right, we'll try to clarify that. Carol Ciraniello? I butchered that. Dr. Alicia Reck? Followed by Adam Boehm.
Boy, you're Hi, I'm Dr. Alicia Reck. I'm an ER physician, and I work at both Manatee Memorial as well as Lakewood Ranch Hospital ERs. And I didn't plan on speaking, but I feel like I need to clear some things up. It's scary. It's terrifying. I'm working in the ER. There's no beds in the ICU, no beds in the step-down unit, which is just below ICU, no beds on telemetry. We have 30, 40, 50 holds of ICU patients that are in the ER that I'm trying to take care of for 24, 38 hours when I'm on my next shift because they don't have any room. So there's lots of statistics and lots of things like, oh, well, what about the flu? I've been an ER doctor for 10 years and I've never seen anything like this. Like the flu happens every year and I don't see where my hospital is overwhelmed. So for me, it's personal. It's scary because I have 5 ER doctor friends that I know that are sick with COVID, that I'm just praying they get through it. Horrible pneumonia, can't breathe, fevers, everything. And, you know, I'm living away from my family. I sleep in a guest room since March, away from my husband. And, you know, somebody was saying we make money. Like, the only coding I can do is ER or COVID exposure, or COVID. So if they have pneumonia and I think it's COVID, I tell the hospitalist that, but I don't put COVID. I put pneumonia until they get tested and find out the real thing. We stop at stop signs because it's the traffic law, and people say, oh, it's infringing on my freedom. Well, we have the right to not stop at the stop sign and potentially kill ourselves or other people. And I feel like it's a small sacrifice to make to wear masks to help prevent the death of ourselves or other people. And, you know, I try to do it to protect my friends and my family when I'm around them. I'm afraid to kiss my husband and my kids. It's terrifying, honestly. And the fact that somebody gave staggering statistics about money that people are making off of billing for COVID pneumonia. I'm not seeing any of that money. I wish I was. I don't know if it's the administrators or the insurance. Who knows who that millions and hundreds of thousands of dollars for COVID diagnosis is going to, but it's definitely not me. So I have no incentive whatsoever to say COVID. It's just like every single patient. I had a patient the other day with like a stubbed toe or a heart complaint or whatever, and every single chest x-ray is bilateral infiltrate. It's terrifying. And so it's not, for me, it's not political. It's personal. I just want to be safe for other people and for myself and for my family. And I think that it's not closing down businesses. We're not talking about closing down businesses. We're talking about having it so that people wear masks. And personally, the fear thing, people say, oh, you're scared to see people with masks. I'm scared when I see people without masks because I don't want them to spread it to me or my family. My mom has MS. She's high risk, and I'm like, I hope that everybody's wearing a mask if I have to, like, take her to the grocery store or something. So
Thank you for your time, and I really appreciate your consideration in passing this bill.
Thank you. Thank you for your service. All right, Mr. Adam Boehm and Mr. Boehm, do you need assistance to make your presentation?
No.
Okay.
Can you hear me with the mask on?
Yes.
Awesome. Okay, cool. Every reason I hear that's against masks is a selfish personal issue. We who want masks, it's mainly for our community. I don't want to wear this mask. I don't like wearing it. But I would really like to just put this all behind us. And I don't think that'll happen until we can do everything we can to help, mitigate that fact. And the CDC also says that 1 to 2 months would help significantly lower the rates of the virus. So you guys were talking earlier about how long it should be. I think a month, and then maybe reevaluate that, and then go to 2 months. Under Section 3, an individual must wear a facial covering in the business except for under subsection 2A if they are maintaining 6 feet of distance, or subsection 2C for those who cannot tolerate a facial covering for a medical reason, sensory reason, or anything else that makes it difficult. I believe that you guys need to revise this section so that, excuse my language, but snowflakes can't take advantage of these loopholes. Anyone can print up a fake medical card such as this, carry that in their wallet, and then put that put it on the underpaid essential workers problem. Make it so he has to decide if he's going to try to kick them out or call the police to deal with it. We need a clear mask ordinance that requires masks in public, point blank. Sorry, I'm really unorganized. If you can't wear a mask, then maybe you should get somebody to go out shopping who can. My county commissioner is Steve Johnson, and I just want to let you know that you personally have let me down, and like everybody on the board has let me down for not doing something sooner. The fact that you guys have let all these Trump supporters and anti-maskers get to your head and affect your vote against the health and safety of our community really shows that, how little of a backbone that you guys have. And exactly. Leaders lead, and they aren't supposed to be going against what's for the best interest of the community. Mayor Paston is quoted by saying that leadership is key to me in everything that I've ever done. Mayor Paston must not know what the definition of leadership is. If he's willing to say he's a leader, then he should probably be willing to prove it, or is it just that he's trying to save face since he's not up for re-election? I'm not going to stand here and try to, tell these people why masks are important. Wearing a mask is simply just caring for your community. If this is a political issue, and everyone here who isn't wearing a mask should be really ashamed of yourselves. Even Trump now says that you should wear a mask. He thought it made him look like the Lone Ranger. Your number of cases have gone up 2,000 in 10 days. We need you guys to hold the public's hand and lead them to the right direction because they aren't going to do it themselves. Also, I think to everyone that's here defending no mask, if your reason for not wearing a mask is because your rights are being taken, you should really pay attention to what's going on in Portland right now and Seattle because you will lose your shit. Defund the police.
Thank you.
Black Lives
Thank you.
Matter.
You're done. Thank you. Scott Clulow to be followed by Jasmine Bowman. Is Dr. Clulow still in the audience?
Yeah, he was a little while ago.
Dr. Clulow? Yep.
Here it
Okay.
comes.
About snowflakes.
Good afternoon, everyone. I'm here to speak for myself as well as the Manatee County Medical Society. I've been a practicing physician here in Manatee County for the past 18 years, and I'm here to support the mandate. I know it's been very controversial. I thank the county commissioners for at least having this venue for everyone to at least voice their opinions and concerns and the importance of why we should have this mandate. And also, you've also heard from Dr. Bensi, and mask mandates work. I mean, I think you have to listen to the facts, listen to the experts. They decrease the rate of transmission. I've seen patients here in town, in my office, not necessarily in the office, but at least on televisits, who have contracted COVID. They've recovered. I've had patients who We've seen who's have COVID and are still having long-term ill effects from the disease. We've had patients who are hospitalized with COVID, still in the hospital. We've seen people die. Unfortunately, the sad part is, because this infection has killed a number of people in the hospital, those patients suffer the most, the families, because they can't even come in to see their family members. We talk to those family members. We try to at least give them information. They can't come to the hospital to visit those patients. We are at the front lines. As you heard some of the other physicians today, we're at the front lines seeing these patients and their families. They are the ones that worry us, that when people aren't masking, we get to see those patients, not only as ourselves as healthcare workers, patients or my nurses and other people I work with in the office, but in the hospital. We're not only worried for ourselves, but we're worried about the patients we have to take care of and the extra stress on the system, not just on the physicians, but the nurses who have to work every day. If you had to go onto a COVID unit in a hospital and see what those nurses have to do in the uniforms that they have to wear to protect themselves in order to take care of patients, you would be amazed. They go under conditions that I can't even think that I would even want to undergo. But I have to praise them. So I would also like to say that I value the guidance and commitment that our commissioners make to this community to keep us safe. And that's the important thing I think that we have to think about today. And that is about public safety. That's what this issue is about. I know we hear everything about everyone having certain rights. I don't want to wear this mask as much as anybody else. But if it means protecting even one person, it could be your grandmother, it could be your mother, it could be someone who you think, and I keep hearing this, that people want to say that it doesn't affect young people. I have a young guy who just was vented today. And I can't believe that people would say, it's not going to affect me. I don't have to wear a mask.
Yeah.
I'm sorry. It may.
Thank you.
Thank you.
Jasmine Bowman, to be followed by Juliana Dale. Is Jasmine Bowman in the audience? Okay, Ms. Bowman, please come forward.
Someone else said previously, I forget which person, but this year, for the first time ever, healthy people were quarantined, which is pretty crazy. In fact, some of my friends are still basically under house arrest, so I'm luckier than that. But this is like the first time I've ever been aware of healthy people being forced to wear masks. I totally get like doctors and nurses and surgeons and like people who work in nursing homes. But everyone, healthy people, most of us are healthy. I would reckon the healthcare professionals are using quality masks, or I would hope so. I really don't know. But the ones I see are these, hanging from people's windshield, like their rearview mirrors and like hanging from their chins and stuff. And so like I was just curious about it because, you know, I didn't, like they look really chintzy. And I went and found a box of them. I could only find the child size because they sold out of all the adult ones. All the people are buying them. But just reading off the box through all the indications under number 4, it says, not intended for antimicrobial or antiviral protection or related uses or uses for infection prevention or reduction or related uses. You know, same 3 layers of polyester made in China thing. So it's a symbol. This isn't, you know, doing anything. It's just a symbol of compliance. And I don't comply with it. I'm not going to comply with it. And I know a lot of people that won't because we're healthy and we don't need it. And I totally get that people who have dysfunctional immune systems probably want to get masks, but hopefully good masks that actually work. But to force it on everyone is totally unacceptable, and I can't stand for that. So thank you.
Thank you. Juliana Dale, to be followed by, Sherry Metrocage. Oh, I was close.
Yeah.
Juliana first.
Can you guys hear me?
Yep.
I'm Juliana Dale. I'm a family medicine physician here in Bradenton. So I just wanted to speak on a couple of things. First, the statement about the incentives of the death certificates. I completely agree with Dr. Hafner. We, as primary care physicians, we just write what the patient expired from, whether that be from COVID or not. Second, I just wanted to speak on behalf of Dr. Evans. He is the ICU physician at Manatee Memorial Hospital. He is on call this week and could not make it to this meeting, even though he really wanted to. And he said that the first, only sentence he wanted to really let the people know is that it is an ultimate helpless feeling being in the ICU right now, not being able to help all these patients. Manatee Memorial Hospital is full. Like Dr. Rex said too, we have no beds in the ICU. We have no beds in step down. Back in March, we had 23 COVID patients when I was in the hospital. That's just my personal experience that week in March. And this week we have 82. So there is a rise of cases in the hospital, patients being hospitalized, and there are not enough resources to get to everybody. Mandating a mask, yes, it stinks. I don't like wearing these. Nobody really does. I hate the fact that I can't hug my patients. I can't give them a handshake. I'm having to do telemedicine visits with them and not seeing them in person. And that's one of the best feelings about being a family medicine doctor, is having that relationship with patients. But it is for their safety. It is for the safety of the community. And these masks, although they protect me not giving the virus to somebody else, if two people have the mask, it's more of like a double protection, right? So if one person doesn't have a mask, but I have a mask, it's a single protection. But if both people, then it's just more protection. And what's wrong about having more protection when this is a virus that we don't know much about? And I will gladly admit I have a medical degree, but I don't have, I don't know about this virus because it hasn't been studied. It's not been here for a very long time, and it takes a long time to study these diseases. And the diseases that we have, that we've learned in medical school, they've been studied for years and years and years. So for us as physicians, we're just taking this day by day and just being as safe as possible to help everybody as much as we can.
Thank you. Thank you so much. Sherry Metro Kawaj, followed by Michelle Martin. I know Michelle's been waiting to come up, so Michelle, you're up next.
Okay, my name is Sherry Metro-Cabbage, and I live in Manatee County. And I'm thrilled to be here and talk, although I think it's not going to have any impact. You guys don't give a damn what we think, and you're going to pass it. At the beginning, I was wondering, why are we doing this? Okay, what's the incentive for that? Then I see, oh yes, it's another fine on poor county residents, okay? You speed, you do this, you do that, you keep doing it. Aren't you learning with what is going on around the country? As the previous gentleman said, it was a party thing. Absolutely, he's right. On Trump 2020. But defund the police is coming, and it's going to come from people like me as well, because I can tell you, I'm not going to comply with the mask. Because one, there's no scientific proof for that mask, period. And as everybody else says, I see people putting this mask on at the grocery store. They come out, take it out and put it in their purse. Excuse me, if you're getting that virus on that mask and you put it in your purse, now it's on your purse, you take it home, and it doesn't matter whether you wash your hand or you don't because you touched all the grocery. I gave one example to some of my friends. I said, I'm going to Home Goods, right? And I'm a pretty grossed out person. I pick my nose, I touch my teeth, I go in there, I touch all of those items, and look at this, look at that, and you have your mask on. You buy the one that I touched and you get it home. bingo, you just got my COVID. So all of this, it is nothing to do with saving anything. Third of all, we're talking about saving anything. Worldwide, I'm looking in Google, 650,000 people died from COVID-19. Worldwide last year, 9.6 million people died from cancer. What are we doing about that? Are we going to say, Miss Misty, you should lose some weight because you're 30% more at high risk?
Don't make personal attacks or you will be taken from the podium.
This is the fact.
We
is
don't
that
make
you're at
personal
high
attacks.
risk when you're obese. Obesity is the biggest killer in the United States. We must stop. I came in this country 42 years ago running away from oppression, from dictatorships and all of that. And we're eroding every day. Everything I do, you're going to find. Whether I want to put a ceiling fan in my house, whether it's a speeding, whether wearing a mask or what. What is next? Where are you going to go next? What is it they're going to find and tell me what to do and how to do? How about personal responsibility? I'm a 62-year-old woman. I am at high risk. I've got asthma, and I can't breathe a lot of times. But you know what? That is my personal responsibilities between me and my family. Have a good day.
Thank you. Michelle Martin to be followed by Gary Guerin.
Did you start me?
Well, I don't know. Yeah,
Okay.
go.
Do you guys remember when the medical community told us which cigarettes we should be smoking? Remember that? Remember when the medical community told
Yes,
us
this is Michelle.
that thalidomide was going to cure morning sickness? Remember that? Now here again, we're acting as though the medical community knows absolutely the beginning and the end of everything. We're all disconnecting our brains the minute somebody says, I work in healthcare. I understand that you guys think that you're doing this to be good leaders, but a good leader doesn't make a decision without considering all of the repercussions. Misty, you said that you wouldn't make decisions that aren't well thought out, but you are. This is exactly what you're doing. You don't know when this is going to go away. You don't know if it's when we hit the 3 metrics that Sherry talked about. You don't know if it's when we go below 10%. You don't know if it's been thrown out 2 to 3%, 5%. You guys do not know when this will end. You know why? We have no idea what we're shooting for. We don't know what success means. How do we have any idea if the masks are successful? We're already on the decline. So then what? In a couple of weeks, as we continue the decline, you're going to attribute it to masks and then double down on that mandate? We've heard a lot of emotional appeals today in favor of the masks, but my friends, we do not make law on emotion. It is not your responsibility to placate the fear of your constituents by making a new law for the other 98%. That's not your job. What you're doing is you're asking healthy people to mask up and suck on a bacteria-soaked mask indefinitely and put our own health at risk indefinitely. Except, we heard it today, didn't we? Misty, you said it. I think you're the other person who said it. You're wearing your mask now, so I can't identify you. It came out that we're actually wearing a mask until you're going to mandate a vaccine, right? That's the standard. When the vaccine comes out, then we can all safely remove our masks. You guys are doing this for a virus that has affected 1.3% of the entire population. It's raged through the country, and it's only hit 1.3% of the population. 99% of them recover. What you decide today is going to reverberate through history. And just like we shake our heads in disbelief at the doctors who recommend cigarette smoking, we shake our heads in disbelief at the doctors who added cocaine to the cola to soothe everybody, we're going to shake our heads in disbelief that we ever believed this. We're going to shake our heads in disbelief that Americans let the government do this. And we're going to shake our heads in disbelief that people like you, 7 little local commissioners, went along with the flow and mandated that all Americans mask themselves to protect somebody from a virus that you cannot control. I ask that you please say no to the government mandate. No to government overreach. Stop moving this country toward communism and socialism. This is about a whole lot more than just a mandate. This is how it starts, and I ask that you stop it here.
Thank you. Gary Garin, to be followed by Richard Tatum.
Good evening, Commissioners. I'm sure you're enjoying this as much as everybody else is out here. I'd like to make a statement first, is this is not political. Every time I hear this is about political, it's not about political at all. It's about the mandate. It's not even about the mask. It's not even about all the numbers you're hearing. It's not even about how many people are in a hospital. I don't think a lot of people are disputing that. It's about the mandate. And mandate should scare people. I mean, scare your freedom. This is our freedom you're talking about here. You know, if you're a commissioner and you're advising people to wear a mask, hand out pamphlets, talk to them, mandate is scary. Mandate is, the word mandate should scare you, should scare our freedom. As commissioners, I mean, really, how dare you even think about mandating something like this? This is not a communist country. We're not going to be sent away to education, re-education camps if we don't believe all this stuff. That's basically, I had a long list of things to say, but when it comes down to it, it's not about the mask. It's not about all the doctors and who we're saying about it. It's about the mandate. You shouldn't be allowed to have a mandate. This is not the way to go. And this is going to reflect on your election. I'm sure the people that are against this are going to remember this at election time. So I'm asking you not to vote this in or to modify it to it's less invasive. I don't know how you could even think to do this, this mandate. But thank you for listening, and that's all I have. I made this quicker than anybody else did.
Good job. Thank you. Richard Tatum, to be followed by Jackson Tyler Mullins.
At one point in time, I thought maybe I had political aspirations, but I don't know if I want to be on that side after the last 5 or 6 hours I've been here. But so, in my background a little bit, just real quick, I'm a retired military guy. I'm kind of a philosophy major. I'm getting a PhD in that right now. And so one thing that I saw today, which was kind of frustrating, is all I saw was the medical experts talk. I didn't see any psychologists. I didn't see any economists talk about economic impact. I didn't see anything about suicide rates or anything like that. And it seems like the medical science is what's driving this, but we're really not taking into consideration the economics, the fact that suicides go up in proportion to the unemployment rate, which has gone from, 4% to 10%. So when I look at the debate that we had from a philosophical standpoint, I say, man, all we heard was from the medical side of the house, and that's important, but it would have been nice to hear from some other people. I also do leadership training. I did, and that was kind of in-person workshops until the virus wiped that out. But maybe going along with what the gentleman said previously, is it might have been a better idea to take into account everybody's needs, objectives, and challenges, and sit down with the chambers of commerce and some, like the restaurant associations and some of the business owners, and say, hey, how can we get together and come up with some good ideas and good plans to really mitigate this a little bit? What could we do instead of mandating it from the government? It would have been nice for all of those concerned parties to sit down and get together, and I think you would have gotten a lot more buy-in and from people than coming down with a government heavy hand and saying, okay, this is what we're going to do. So I would recommend that in the future, that you have a larger panel of experts that are from a wider range of points of view, and also that you come at this from more of an organizational standpoint and get all parties involved to buy in. Because I'll go into private property if you want me to put on a mask, fine, but I'm really not, it's like people have said, when you start mandating these type things, where does it stop? And we've already seen, for instance, that when we were told to stay home because it's safer at home, it would actually be safer to be outdoors, right? I can cite a lot of statistics that show that. So that's my point. Make it quick. Get a wider range of point of views, and then make it a more collaborative process throughout the community instead of mandating it at the government level. Thank you for your time.
Thank you. Jackson Tyler Mullins.
Where does he live?
Ms. Vanessa, you can check out
Good
all the
Commissioners.
sign-ins.
My name's Jackson Mullins. I'm a small business owner and EMS worker. I have been on several deployments with DHS and DOD throughout the years. I've also assisted Manatee County Sheriff on a few arrests on local security ports with drug usage and some other things. On the standpoint, small business owner, my business is failing due to COVID. I spent a recent deployment in Texas dealing with COVID patients. I was on a 24-hour shift. We worked a code because there was no rooms in the hospital. The patient died. A friend of mine, when I got home later that month, I got called up to DC. Friend of mine, ex-Marine, U.S. Air Marshal, died from COVID. He didn't die from gunshot trauma. I treated him from gunshot trauma in 2011. He died from COVID. I myself have been shot several times in the line of duty, and Florida Statute 493 does include arrest powers for security officers on a post. So if in fining, civilians or whatever the case may be for that fine, it's not about mandate, it's about protecting the fellow man. You've lost someone close to you, but if we don't stop it now, when is it going to stop? It's a disease we have never seen before. It's not HIV, it's not AIDS, and I've dealt with Ebola, and Ebola scares me less than COVID-19 does. I don't do politics. I care about my fellow man, but knowing the fact that if I can wear a mask that helps or could possibly save another person, I've done my job as a civilian, as an EMS worker, and as an officer. That is all.
Thank you, sir. All right. That's the last person I've signed up. Who do we have on the phone, Mr. Osborne?
Madam Chair, we have quite a few people on the phone. Just to reiterate the phone number, it's 888-788-0099. That's a toll-free number. And there's a meeting ID you need to enter, and it's 869-7082-7338, followed by the pound sign. If you missed that, you can go to mymanatee.org. This is our website, and in the search bar, just type agendas, and you can find your way to the current board meeting agenda, and on the top it has all the relevant call-in information and that meeting password. So callers on the phone at this time, I'm gonna ask you to press *9 on your phone, and that'll separate y'all from who really wants to speak and who really is just on the line listening. So if you hit *9 on your phone, it'll virtually raise your hand so I can see it. So Madam Chair, we have a few people that have raised their hands so far, and so callers that raised your hand, once I unmute you, you're going to hear an audible voice saying that you are unmuted. And once you hear that, please state your name, and you'll have 3 minutes to speak on this item. So caller with the last 3 digits of their phone number of 364. Caller 364, you are unmuted, and you have 3 minutes.
Hello, can you hear me?
Yep.
Go right ahead.
Okay, hi. My name is Tara Tomlinson. Before I get started, I wanted to mention that I think it would be wise for the board to be more specific about the term face covering, because there are those who are wearing masks made out of netting and other sheer material just sort of out of spite. So I just wanted to mention that. I'm a local wedding photographer, and I wanted to address the board from the standpoint of the small business owner. One of the rallying cries of those opposed to the shutdown in the spring was, what about the small businesses? Well, yeah, what about the small businesses? Have they truly benefited from reopening without a mask mandate? I don't think so. I think that it has only prolonged our suffering and may ultimately end with many losing the businesses that they have worked so hard to build. I started my career a decade ago as a single mom. It wasn't easy. There were times I couldn't keep my electric or phone on, but I persevered and, quote unquote, pulled myself up by my bootstraps, as people like to say, created a better life for my family. Since the start of COVID, 16 of my 35 2020 weddings have canceled or rescheduled, and I expect many more of those to come. Back in April, my hope was that the community compliance, the shutdown and mask wearing would enable us all to be able to continue to have weddings in the fall. But now my couples with booked weddings for October all the way through January are starting to ask about rescheduling, and some have already done so. Every wedding that reschedules to a 2021 date is a date I cannot book for 2021 for a new couple. And this is true for all wedding vendors. Because of this, the severe financial impact to wedding vendors is double what we see on the surface and will last twice as long as it will for, say, those in the restaurant industry. I support a family of 5 with my income, and I've already gone 4 months with 90% of my income gone and no unemployment. Now it looks like it will be another 6 months at minimum. It's not only myself and my family who are suffering because of this. Over $100 million a year goes into our local economy from the wedding industry, and that's not counting the money spent by guests at hotels, restaurants, bars, etc. Almost all wedding vendors are small or micro businesses. Most of those have not received unemployment, and only a small percentage have received small business assistance. But the far-reaching effects don't end there. This is also crushing the dreams of couples who have invested so much time and money into planning their day, a day that they want to share with their elderly grandparents and loved ones. Instead, they may lose some of those relatives without ever getting to celebrate with them. It didn't have to be this way. We could have been like other counties, states, and countries who buckled down and did the right thing. And then we would now be closer to having community spread under control like them. Instead, we have thrown small businesses under the bus, all while giving lip service to how much we care about them. Do we really? Or do we only care about them insofar as it serves our own selfish desires to not be inconvenienced in any way? Are we really so weak as individuals and as a community that we cannot do hard things for not only the greater good, but for our own good? I'm pleading with you as community leaders to lead and to side with science, healthcare professionals, and yes, small businesses to help us get this under control. If I can wear a mask for 8 hours outdoors in 95 degrees, then people can wear a mask for their 30-minute shopping trip to Target. If kindergartners can be expected to wear a mask for the majority of a 6-hour school day, why can't their parents wear one to get groceries? If people were genuinely afraid that masks would make you drop dead from lack of oxygen or carbon dioxide poisoning, then why would 50% of parents be willing to send their children to school knowing they could drop dead from their masks at any second?
Thank you,
If we
Shannon.
want to get back to normal, we have to be willing to be temporarily inconvenienced, and no one is asking anyone to do this forever. So let's not drag this out indefinitely. Our small businesses depend on it.
Oh, could you hear us? Thank you, Shannon. You are a fabulous photographer. If I think I know who you are a fabulous photographer. I'm so sorry about what has happened to your business, but she was my daughter's photographer. All right, John, go ahead.
The next caller we have with the last 3 digits of 272. Caller with the last 3 digits of 272, you're unmuted and you have 3 minutes. Please state your name.
Hi, this is Walter Wolzak. I live in the Lakewood Ranch area. Hopefully you can hear me okay.
Yes, sir. Please go ahead.
Okay, first thing I'd like to mention is I have a next-door neighbor who is an infectious disease specialist doctor, and her comment would be to you that seatbelts save lives in cars, and that was mandated in 1968. I looked it up, and it was more controversial than what you're dealing with today. Her comment is masks save lives, and we just have to mandate that as a national law and be done with it and quit the controversy. Now, being a data analyst, I wanted to bring up some numbers that you haven't discussed today, and that is the reason of why is Florida constantly in the news, and why is it at the top of the charts in the entire world as far as this whole situation with our coronavirus cases. So in the Saturday paper, there was a nice chart that showed how many cases per day are happening per million people, because you compare apples to apples. So in the United States right now, it's 204 cases per day, new cases, and per million. Florida, 540 cases per million. And then I also looked up, and by the way, Florida is in the top. It's got more cases per day per million than any nation. I looked up Manatee County. Yesterday, they reported 150 new cases. Divide that by 0.403, that's 403,000 population. Comes out to 372 cases per day per million in Manatee County. So Manatee County has more cases per day than, for instance, by comparison, the state of Texas or any other country in the world. So we have a huge problem here, and we are sadly not doing anything about it. I mean, it's absolutely horrible, obviously. My feeling is it's an attitude problem. With regards to how many people are getting ill and all these numbers, you're missing the situation altogether. 48% of people that are asymptomatic. What is asymptomatic? To get tested, to be asymptomatic, you had to produce millions of virus cells coming out of your mouth. That's happening inside your body. What researcher after researcher is saying is that asymptomatic people are not noticing that they're getting lung damage, they're having strokes, they're getting heart damage, brain damage, etc. One pilot had an oximeter and was noticing that his oximeter was reading below 90%. Checked himself into a hospital, and they put him into an ICU right away. He was failing, didn't really notice it because he was just ignoring most of the symptoms. Asymptomatic people really aren't asymptomatic in terms of, oh, I'm perfect. No, it's more like cancer. You've got problems. You sort of think you're dealing with it, but in the meantime, you're going to have a stroke or your lungs are losing capacity. You're fighting something, and there's millions of these cells coming out of you and infecting other people. About 50% of the people are infecting other people. That's the whole purpose of these masks, is stop the infection rate. And I hate to say it, but you're going to have to do more than masks. There's an attitude problem in the whole state of Florida that has to get fixed. The government's idea
Thank you, sir.
of back to
Your time
normal,
is
there's
done.
nothing to see here, that's a big problem. That
Okay.
has to get improved.
they
We
hear
have to
us.
change the mentality of people here. It's
Thank
not
you.
just masks.
Your time is up.
Anyway.
Thank you, sir.
Should
right.
John be the one that tells them their time's up? Because maybe he's the only one that they can hear.
They can hear everybody, I
They
believe,
can hear
Commissioner.
Can? Okay.
Okay. How many more people do we have?
We have 4 that have their hands raised. One more.
Okay, I am going to step out for a sec. Carol, you will take over as chair, but go ahead, John. Announce the next person. I'll be right back.
All right, caller with the last 3 digits of 000. 000, you're now unmuted. Please state your name for the record, and you have 3 minutes.
Pastor Ralph Holm from the Source Church.
Thank you, sir. Go ahead.
Thank you. We're just very concerned. Thankfully our church is in the city of Bradenton and we're not in the county. But we've had no problems, no issues. We've been open the whole time. And to push an agenda like this on church organizations is a huge concern. I don't know if the government legally even has a right with separation of church and state to get into that, but just to be in a battle with the people is very negative. It comes across as very negative. And I really think to push something like this, the United States represents the home of the brave and the land of the free. It sure doesn't sound like it right now. It sounds like the land of the fear, people being in fear and what have you. And the people that are infected, and I think there's, they keep the areas like the seniors' homes and stuff closed down. I understand that. But to go after the majority of people and force them to do stuff is very un-American, and it's very unconstitutional to step on people's rights. And, we're thankfully not having to deal with this in the city of Bradenton. But I feel for the churches that are in the counties that are going to be forced into stuff, and they're going to have battles, and it's going to get very political, unfortunately. And I just really think it's irresponsible for anybody to be pushed into doing something that they shouldn't want to do. This is a free country. This is why America is the greatest country in the world, and we can't forget that. And we need to let people make decisions, whether they're good decisions or bad decisions, and let them have the consequences of those decisions. And I'm telling you, from a church end, we've been open all along. We've had no problems. We've had no issues. We don't tell people they don't have to wear a mask. If they want to, they can. Some do, some don't. Some people watch online. It's all okay, but we want to, give people the freedoms to have the right to just make their own decisions. This is America, and I just want those thoughts to be put in as you guys vote, because if you vote for this, it's going to bring a lot of stress into this area here for no reason whatsoever. And most of the people that we know are against masks. I haven't heard anybody that was pro-mask, and so that's just a very big concern. So we're just wanted to voice that. Thank you so much.
Thank you.
Thanks, sir.
Thank you.
Caller with the last 3 digits of 887. 887, you are unmuted. Please state your name for the record, and you have 3 minutes.
Hi, my name is Tina Page, and I'm a Manatee County resident. I live in Greyhawk Landing.
Go ahead.
And I just want to say that I am completely in favor of the mask mandate. And I have been, since the very beginning, hand making hundreds and hundreds of masks for my neighbors and friends in my neighborhood, small businesses, doctor's offices, a vet clinic, restaurants, individuals, children, people want to be safe. They want to do their part. They are asking, they'll reach back again and, oh, I have a family member that needs some. Oh, they put in a, this nursing home is having a problem. We don't have enough PPE. Can you make us some more masks? And I've made over 1,000 handmade 3-layer with insert pocket and wire, adjustable, complete face masks for those people for free. Because I feel it's important, if it saves one person's life, it's worth my time and effort. The hundreds of hours I've spent. I partnered with a philanthropist who has COVID filtering material that was discovered by UF, and an engineer who designed a mask that is able to not only protect the wearer, but the people they come into contact with. It's not N95, but it's darn close. And we've made thousands of those through a virtual assembly line and sent those to ALS, nursing homes, hospitals in need in Manatee County and the surrounding areas. And these are all people volunteering their time because of how important this is to put a stop to this and to slow this. But for every person who wants to participate, who feels it's their duty as an American to help their fellow man and love thy neighbor, there's somebody else standing by the side, thumbing their nose at it. They're the ones that are spreading it. They need to be told, you have to do it. In order for this to stop, we need everybody's participation. It can't just be people who feel patriotic or feel like they care about their neighbors. It has to be everybody. It needs to be mandated. There needs to be a penalty if we're non-compliant or it's meaningless. I thank you so much for your time, and I want to specifically thank Misty for all of her hard work and for gathering experts, putting out all the educational videos so that people can make informed decisions and understand what's going on. Thank you for your time.
Thank you.
Thank you, caller. Just one as a reminder, if you have called in and you would like to raise your hand, which lets me know that you want to speak, dial *9, and that'll virtually raise your hand so I can see that you want to speak to us. We have a few more callers, commissioners. If you have the last 3 digits of your phone as 042, caller 042, you are unmuted. Please state your name for the record, and you have 3 minutes. Caller 042, go ahead.
Your last 3 numbers of your phone number.
Last 3 numbers of your phone number, 042, you're unmuted. Okay, we'll put you on mute, and maybe we'll come back to you. Caller 623, the last 3 digits of your phone number are 623. You've been unmuted. Please state your name for the record, and you have 3 minutes.
Good afternoon. My name is Julia McLaughlin. I'd like to begin by saying that I know there is a virus, but it is not what the media is making it out to be. You just look at some of the skewed numbers that have been reported recently. This has become extremely politicized and no longer directly about health. There have been many studies that have shown that surgical masks and cloth-based coverings are neither effective or safe. The public has been instructed by the media and their government.
I'm sorry, you don't get a second
even
opportunity.
If not sick, may prevent others from getting COVID-19. The New England Journal of Medicine.
Ma'am,
I'm sorry, if you have already had the
Her name was called, but she was not here.
I'm sorry. Is that true? Her name was called, but she was not. Oh, all right, unmute.
Let her have.
Please go ahead, caller.
Hello?
Yeah,
Please.
sorry, we had a technicality. Please go ahead.
Okay.
Please go
Okay.
forward.
The New England Journal of Medicine did an editorial on the topic of mask use versus COVID-19 and assesses the matter as follows. Quote, we know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet of a person with symptomatic COVID-19 and is sustained for at least a few minutes. We're saying between 10 and 20 minutes. The chance of catching COVID from a passing interaction in a public space is minimal. In many cases, the desire for widespread masking mandates and ordinances is a reflexive reaction to anxiety over the pandemic. In many ways, it's a fear-mongering mentality. Let's talk about anxiety for a moment. My mom absolutely cannot tolerate any type of covering on her face due to claustrophobia and anxiety. She is more fearful of the violent bullying and awful words and actions from people who couldn't care to know the reason that she can't wear a mask. The virus itself to her is less frightening. A virus with over a 99% survival rate. 92% of Americans that surveyed said that they're wearing masks not to stop the spread of the virus, but just so they're not publicly shamed. This is what we've come to: bullying, shaming, government overreach. And the vast majority of people don't need the government to tell them how to handle their health. People should have the freedom to be responsible for themselves. Thank you. No mask mandate.
Thank you.
Thank you, caller. Let's try again. The phone or caller with the last 3 digits of 042. 042, are you there?
Hi, can you hear me now?
We can hear you now. Please state your name for the record, and you have 3 minutes.
I had muted myself.
No, you're perfect.
My name is Cassie Rankin. Thank you for the opportunity. Hello, commissioners and community members. My name is Cassie, and I am an essential worker. My mom, who works at one of our county's many ALFs, and is 66 years old, is also an essential worker. Her and the residents at her facility are involved in every decision that I make. Personally, I'm very lucky to work at a place that has enough space to properly social distance. Not every business has this luxury. But even then, we wear masks when we are up from our desks or interacting with customers. When I am not at work, I am very adamant on wearing a mask inside any store, not just for me, but because what if someone else is in a situation like me, where they have dozens of elderly individuals who are more susceptible to illness in their social chain? There is no way to know who someone may be connected to. So I want to do my part in keeping everyone safe. If it is simply wearing a mask while out in a business setting, so be it. Unfortunately, if you've worked in customer service or any of the like before, then you know that sometimes customers can get a little testy. If there was something, anything, to back private, small, local companies, even just for a short period of time, then essential workers and business owners may feel much more comfortable standing their ground. It gives our local businesses a lot more credibility and strength when customers are selfish and cause a scene simply because they don't want to wear a mask. I have also heard a lot of people say that they have seen young people not wearing masks. Unfortunately, however, a huge amount of our young community members are currently out working as essential workers, like myself. We are not on vacation. We are out serving our community. Now, unlike many essential workers, I was able to call in to share my thoughts here with you today. Unfortunately, many others of all ages could not. It is a privilege to be able to tune in to meetings such as this. It is a privilege to not be at work at this exact moment or have the ability to take off. Please think of everyone you have heard from. Are they able to control how many people they interact with? Most essential workers are not. They don't get to choose. That is why they need those who can control how they are currently socializing to do their part in keeping our community as healthy as possible. I care about our community, and I am a firm believer that everyone in our community is important, no matter their age, race, or socioeconomic situation. We should all have our health considered. Nothing has to be permanent or turn foul with legal punishment. No one would ever want any of those things. I just ask that you please take my words to heart and think about those in our community who depend on your support for the health of themselves and their loved ones, especially those who are out working the front lines to support their families that do not have the availability to tune into this meeting and share their thoughts on the matter at hand. Thank you very much.
Thank you.
Thank you, caller. Caller with the last three digits of your phone number is 341. Caller 341, I'm going to unmute you, so please state your name for the record, and you have 3 minutes.
Hi, I'm Debbie Terrell. Can you hear me?
Yes, ma'am, go ahead.
Hi, I'm Debbie Terrell. I've lived here since 2009, and the majority of my family is up in Chicago. And I think that our mask mandate doesn't go far enough when it is compared to that of the states that are making serious progress. I believe that our mandate should be to wear masks anytime you are outside off your private property. Period. Simple. No exceptions. That's how other countries in the world and other states in this country have gotten their COVID rates to drop by taking serious action. I really wonder, with all of these anti-mask opinions, how would we have ever survived World War II when they instituted mandatory blackout curtains? How many of these people would say, oh, no, not me, I can't, I won't? Anyway, enforce the mask mandate. Make it tougher. Make it stronger. We need to protect each other and all work together as a team. I'm done.
Thank you, caller. Our next caller has the last three digits of their phone number as 736. Caller 736, you are unmuted. Please state your name for the record, and you have 3 minutes.
Hi, this is Lauren Kelly. I'm a physician. I was at your meeting for about 4 hours and just had to get back home, but it's nice to virtually be with you with this option. I would just like to voice my opinion with the other doctors that the mask mandate is going to help us to get out of the quarantine faster, keep businesses running, and have fewer people in the ICU. And as the doctors who are working in the ICU are telling you, it's full. At some point, they're going to have to make harder decisions than whether or not to put on a mask about who's going to get a life-saving ventilator or life-saving medication. The mask is a simple fix. It works. It's backed by science. We can all have different opinions about wearing them, but it works. And I think that you guys are doing the right thing if you vote to pass it. And I'll just keep it short and sweet. Thanks.
Thank you.
Thank you, caller. So our next caller has the last three digits of 347. So caller 347, you are unmuted. Please state your name for the record, and you have 3 minutes.
Hi, my name is Tammy Barton. I've been watching from afar, and glad that I get to speak. First, I wanted to just say that in your resolution, you have 3 whereases from the CDC, the Florida Medical Association President, and the State Surgeon General that all recommend, urge, and recommend. They do not mandate. Additionally, some of the information that I received from Jacob from the 23rd of July states that the percent of positive cases since March 1st was 10.3%, and the percent of positive cases over a 7-day rolling average was 10.1%. So I'm really trying to understand the hysteria if the percentages really have not changed that much. My question is, most of the retailers have already set their policies, like Dollar Tree and Walmart and Home Depot, and a lot of those have backtracked on those policies because it is creating a hostile environment in their business. So now the Manatee County Commission is going to come back and try to reinstate policies that they've already backtracked on when they feel it is unsafe in their business. And how is that going to be handled? Finally, where there is risk, there must be choice. And I don't see anywhere in your resolution where you have provided for informed consent for potential risks of mass usage by healthy people and bacteria and moisture and fungus and everything that may be accumulating on these masks and creating additional illnesses. And that's a big concern for me. Lastly, I drive that the World Health Organization indicated that masks on their own will not protect you from COVID. They advise government that government should encourage, again, they don't ever say mandate, it's encourage and recommend that they wear masks in public. And also masks can create a false sense of security, leading people to neglect measures such as hand washing and physical distancing. So in addition, what happens when the numbers do not go down with these mask mandates? Those are my biggest concerns, and I appreciate your time.
Caller 347, can you restate your name for the record? You were a bit muffled in the beginning.
Tammy Barton.
Thank you so much, caller. Okay, caller 189, last three digits of your phone number, 189. I'm going to unmute you. Caller 189, please state your name for the record, and you have 3 minutes.
My name is Dawn Kitterin.
Go ahead.
Hello, commissioners. First, it was a hoax to affect the election. Then I was told it would disappear. Then it was a bioweapon. Then it was about controlling people. Then it was the 5G. Then it was due to unhealthy lifestyles. Then it was the fault of the media. Then it was a lie by the WHO, the CDC, the NIH, spearheaded by Dr. Fauci, assisted by Gates, and intended to vaccinate us all with microchips. Then it was a numbers scam by the state health departments, and now doctors are in on it. Hospitals are lying, nurses, physicians making up stories, overrun facilities, shortages of beds, staff, and medications. And apparently they're lying about the debt. They're labeling COVID regardless how the people die. Almost everyone is in on this conspiracy, or there's a novel virus threatening our communities. Our government has departments created to inform decisions and guide response in emergencies. Qualified experts, many of whom have served under multiple administrations to both parties, and they are paid by the taxpayers to advise our leaders and educate the public. In the absence of federal and state In the absence of effective leadership from the top, the void is filled with confusion. When leaders on the federal and state levels have failed to enact the recommendations that are researched and shared from sources normally relied on in emergency situations, it has left too many of us confused, distrusting, and sadly unclear on the facts. This leaves it up to you, commissioners. You must do the work that those before you failed to do. As commissioners, your responsibilities include knowing the goals of our community and identifying and addressing any obstacles in the way of those goals. So what is our goal here? Both sides of the debate want the same thing. We want our economy to remain open, and we want it to stay that way as long as it's safe to do so. Our county is showing weekly increases in infection, hospitalization, and statewide deaths are increasing. Tests are taking 7 days to return, and I personally know of people who have waited as long as 15. This is unsustainable. If we do not collectively utilize the tools we have as citizens, social distancing and masking, then the economy will continue to be a slow bleed as workers are forced to isolate for weeks awaiting test results either at the expense of the worker or their employer. We need to slow the spread, speed up testing, and at some point have testing efficient enough to make contact tracing possible. Whether an individual understands the science or trusts the experts, there is zero risk for a healthy person to wear a mask in public. Even if they believe it won't work, it won't hurt them, and it's a small thing to do. It is temporary, it is necessary, and it is supported by the science. When we reopen schools, kindergartners will be told to wear masks for up to 6 hours a day. Us adults owe it to them to do it on our 45-minute shopping trip. So, commissioners, please consider the community goal and your individual responsibility to lead us toward that goal. Recommendations are not enough, not when a portion of our community is lost in the muddied waters of facts versus conspiracy. It is not enough to say we are counting on the public to do the right thing. We've already tried that. Not enough will voluntarily follow those recommendations. And maybe not because they're selfish, but maybe because they are confused and lost without a unified message or leadership. We all have the right to health and safety and a protected, open economy. Thank you.
Thank you.
Thank you, caller. Anybody else like to address the board? Dial *9 on your phone. If you haven't addressed the board yet, *9. Callers with last three digits of 707. You are unmuted. Please state your name for the record, and you have 3 minutes.
Hi, my name is Laura Paraga, and I'm in Manatee County.
Go ahead.
Can you hear me?
Yes, ma'am. Go ahead.
Good afternoon. Thank you, commissioners, for meeting. I know this is a very difficult time for you guys, and y'all are hearing lots of different options. And I'm really just hopeful that y'all will see the big picture and not really go one far direction either way. I think that most of the public, unlike what the previous caller said, I do think that most people are wearing masks when they go into stores, whether they're made to or not. And I do believe that, you know, if we continue to educate and if people, whether they believe or not, I do believe that most people will wear masks in our area. I don't think that a mandate is needed or it's even constitutional. I feel like that we can give recommendations just like the CDC, just like everybody else has, but we can't, when we do a mandate, it's just going way too far. I think recommendations are the way to go, praying and hoping that people will follow the guidelines the best that they can. I do, however, want to request if a mandate is made that we will give some detailed information for those that are exercising, those that are eating, those that have health issues. So there's real clear guidelines for those small businesses like mine that don't have the ability to, say, wear masks all the time. So I would appreciate just detailed guidance if the mandate does go through, but I really hope that y'all will lean more towards the middle and give recommendations, because most people do follow those guidelines. And I think if y'all show that you're middle of the road, you want to do the best you can for our community, we highly suggest every business, having masks and a sign on the front door will be really enough for our community, because I just don't know that wearing them makes that big of a difference anyway. Thanks so much for all you do. I appreciate you listening.
Thank you, caller. Commissioner Benak, that is all the callers I have on the board.
All right, I'm going to call one last time. Is there anyone who has not had the opportunity to address the board on this issue in this building? Is there anyone who wants to address the board on this issue? All right. Seeing no one come forward, I'm going to close. Anyone next door? Reggie, did you see when you were out there? You didn't look, did you? No one's next door? Thank you. All right, we're going to close public comment. All right, Carol?
Just a
Put
couple
your
things. I wanted
orange
to.
book up?
I held my book up about an hour ago. I want to thank. In fact, when Janet Mixon spoke, is when I held my book up. I want to thank her for her words and what she has done. She's gone over and above, and we've heard from some businesses today, and I know Sherry can bring this up because I know a lot of people are still watching. On these businesses, we'd heard are spending thousands of dollars with PPE equipment. There is help for you. And there's more coming down the pike, and the more we say it, the more we can educate our public and get them help. Because this is not your fault. This virus is not your fault. This is something that we have to deal with for infection control. The disability, the lady came with the little dog. She qualifies not to have to wear a mask, and her doctor just has to write a note. I think, and a couple people that just spoke now, if their doctor says it's okay that they can't wear a mask, one of the definitions were claustrophobia, et cetera, they don't have to wear a mask. They just have to go through a process to get it. This is a temporary mandate. This is not a permanent mandate. This is until this declaration or our metrics go down that we feel comfortable. I would like sometime, maybe tomorrow, Sherry, I know you can't probably do that, but the remdesivir and the plasma, the doctors can't even get the doses that's recommended right now. That just broke my heart because they're having to give half of what's required to be able to treat this. That's a state issue. That's a federal issue. That's the first time we heard that. The plasma sounds critical. She said they've ordered it and can't get it. We need to know that kind of stuff, and I appreciate the medical community for stepping up. I do support the warning first, like was mentioned earlier, and I'm sure I'm so tired. Bill will tell us what the recommended motion is, but I would like to make a motion to approve the recommended motion with that change in it.
All right, we have a motion for the recommended motion for the resolution with a change to allow for a warning.
Warning first.
And is there a second to that motion? All right, Reggie, there's a second. I don't see anyone else who's raised their orange paddle at this point. I do have a question about face coverings. There was a request by someone who owned a restaurant
Like
to
Reggie's.
have a, whatever you call those things,
To me, that's
shield.
a face covering.
Can you, I think it's a face covering too, but I'm going to ask if it's addressed in the ordinance and could be interpreted as a resolution.
In the resolution right now, face shields do not satisfy the requirement for a face covering. And we looked at that, and the difficulty with that is the CDC guidelines that are in your agenda package. On the second page, it says the CDC does not recommend use of face shields for normal everyday activities or as a substitute for cloth face coverings.
Oh, bummer.
They have some pretty negative language in there now. I don't know if that's always been the case. You could do it. I mean, I'm not telling you you can't do it because some other jurisdictions have, but you should be aware if you do that it is not recommended right now by the CDC.
And I get it, because if you cough, you know, you saw that thing, it'll shoot right underneath, and it's gonna, and the droplets will go everywhere, the aerosol. So I understand that. I didn't know it, though, but it's good to know that they've already addressed it, and they said it's not recommended.
Can you tell me how recent that is? Because I've looked at some reports from the CDC also
Well-
discussing well, it does change. It does change.
We took this down off of their website as recently as Thursday or Friday, late last week, so it is very recent.
Friday?
Dr. Benson, do you have anything on that?
Yes, thank you. Actually, the superintendent and I had the same discussion earlier this week as it related to teachers. But you are correct, sir. According to the CDC, it is used more in the medical environment to protect the eyes. So it's a mask, and then that if there is splashing of fluids. So that is why they're used in that setting and not in the public.
So we could allow it with a mask? Well, they already can do that.
Yeah, I mean, you can layer on whatever you want if you have a mask, and that's all we address, right?
Correct. It is a board decision. I'm not telling you that legally you can't allow them. I'm just making sure you are aware that the
Well, this
CDC
motioner
is recommending.
won't change that because it's
against
against
them.
infection control guidelines, and I didn't know that it wasn't allowed, but it makes perfect sense, and you got the health department here telling you, you got the CDC, it's all about infection control. So I wouldn't support amending that, I'm sorry.
Let me ask too, I'm going from memory, the gentleman was talking about his workers.
I think he's.
Is he still there?
It's not you, no, I think he left.
Yes,
Yeah.
no.
He was talking about his workers, and if it's a work situation where you don't have the public interacting, then it's a separate situation, right?
Yeah, but if they're prepping food, the CDC is going to tell you that that's not,
Okay, well,
that
I'm
they
not
ought to
gonna-
be masked if they're prepping food. I mean, I understand it's not fun to wear these things. I'm just giving you the guidelines as represented by the CDC.
All right.
Well, I'm okay with it either way. I do know what my precautions are, you know, with emphasizing social distance. I'm comfortable like this when I'm in a group where social distance is very difficult. I have this as well as a mask on.
Do you?
Oh,
Yeah.
good, okay.
All right, again, okay, so we're going to make a vote here. I'm
Well,
gonna
I
talk
do
a
want
little
to,
bit.
when you're ready, I'd like to read the change into the record to deal with the
Right.
written warning when
I
you're
will,
ready.
I will. And, you know, I certainly agree that we shouldn't have to mandate this. We should not have to mandate this. But the reality is, we do have to mandate it because people aren't wearing masks. They don't think that it's necessary. They think it's against their prerogative to make decisions about themselves. But it is about public safety. It's crazy. I never, ever thought I would be in a situation where local government would have to do this. But we live in a state where the governor's chosen not to do it. We live in a country where the president's chosen not to do it.
Let's leave the
It has
governor out of this,
fallen
shall we,
down to
please?
local government for us to make a decision. That's the reality of it.
Yeah.
You know, I think that we are helping small businesses by making this mandate. I heard Shannon say that. I agree. Many small businesses have said, you will help me if you have this mandate. Because guess what? A lot of small businesses don't like having to say that you got to wear a mask. But boy, they don't have any problem blaming it on the government. They don't have any problem saying the government's making you do it. I get that. I've been in government regulation before. I used to tell my clients, I don't like this, but the government's making us do it. All of those regulations and zoning and land use, boy, I'll tell you what, my private property owners hated, and still do, hated those regulations. Farmers hate the regulations. But guess what? The government makes you do it. But why? Why does the government make you do these things? For the public health, safety, and welfare. It's just reality. That's where we're at. We have so few tools out there to try to address this situation. This one has been proven to help. So why wouldn't we do it? And you know what? We're not leading on this. We're following. Most of the businesses are already doing it. We're just following along by saying, yep, everybody's got to do this if you're a small business. I was in the city of Sarasota in a park. I had to wear my mask in the park, walking by myself in a park. Well, that's how the city of Sarasota has chosen to do it. We're not going that far. You know, you have to be able to make decisions to be able to social distance in a park or when you exercise. And I think that's why we're doing the right thing. We're saying if you are 6 foot apart, you don't have to wear a mask. So I think that's a good thing.
Chairman Benak?
Yes, ma'am.
We're hearing the audio's out for the public. Can we hang on just a
Yes.
second?
Sorry.
And see if we can verify that? We're getting messages that the public can't hear the meeting now.
Used to
Oh,
be
well.
they had to change the tape.
It was
The tape ran out.
It's payback because I tried to stop
You wore the
somebody.
battery down,
You cut
that's
me
it.
off. It's payback.
Public would have loved it. Not.
I got the whole neighborhood getting Andre dinner.
That meeting's gonna be good.
Walking the dogs, turning the lights on, getting Andre dinner. I wrote, help.
I didn't want to go to the REC
I'm
anyway.
hearing Channel 30 still has.
It's not till 7.
On TV. I'm hearing YouTube still has.
Doesn't even know what time it is.
On TV.
Yeah, you still got to go.
Commissioner, where would she be watching it? I'm getting Channel 30 with audio and YouTube right now with audio.
I just got 2 texts in, they can hear.
Said it was on METV channel 20.
Somebody just said they can hear us.
I
I'll
got
ask
3
them.
texts now. so
Okay.
they can hear.
Well, I guess
Okay,
we're
we
okay
have-
to go ahead and finish anyway.
We
So
have some. Thank you.
psychological, economic, small business, I wrote down. Yeah, those are all super, super important. But that's the goal. What is the goal? To bring this transmission rate down so that we can get our kids safely back in school, so our small businesses can operate. That's the goal. There's no doubt about it, that our economy can recover. Which, by the way, we didn't shut everything down. We did not do that. That was already done by the governor, and he will open them up, and we're following the regulations of the governor. But we are taking it
Just
one
gave
step
you 10
further.
million.
If we pass this resolution, we'll be taking it one step further. But this commissioner believes that's our responsibility. So that's why I'm going to vote the way I'm going to vote. Commissioner Baugh.
I have a couple of questions that I just need to, I don't feel like they were answered for me earlier, so real quick.
Okay.
In order to repeal this resolution, we still have not decided how we're going to go about doing that? Are we just going to look at the guidelines from the governor on the 2-week period or something, Sherry?
The last two, Commissioners, the last two things I heard you saying was that we would follow it. It is part of the emergency, state of emergency locally, and that we would follow it with the state of Florida's state of emergency, and we would report weekly to the board.
Okay. All right. And by the way, they're hearing the meeting again.
Okay, thank you.
Let's see, there was one more. Now that your larger corporations like Publix, Costco, the hospitals, businesses like Neal Communities, et cetera, are mandating masks in their businesses, I'm just telling you, I received it. Why are we mandating? What do we think we can do better than what the businesses themselves are doing at this point? You know, you've got the Walmarts, the Targets, Costco, the hospitals, I mean, even my store. Yeah, what do you expect? What do you think is going to be different in mandating this that they're not getting and they're doing already?
I think we're going to reduce the COVID positive rates. That's the whole purpose of this.
Well, I'm sure
And
more
every
people
medical
will wear it.
professional, our second largest industry in Manatee County, our medical professionals, I have gotten triple, quadruple, probably all of you. I don't care what people send you in text, truthfully. You know, that they should be here and they have been here, fine. I don't care about that. What I'm saying is we've got many more wanting this, and we represent all the people. And that's why this shouldn't be political, and it is.
It's not political, Carol. That's why I'm asking. I received
I just told
it
you to bring the
from
numbers
a
down.
citizen.
So
I asked.
All right, you got a question?
And I
Carol
answered it.
Yeah,
Does anybody
poorly.
else want to answer it?
No, I
Why
didn't.
would we do this? And I
Get
just
it.
said I'm going to vote for it. So why would I do this? Just to make it clear that this board in leadership believes that you should be wearing a mask. There shouldn't be any question. From this board's perspective, you should be wearing a mask, people. We made it a mandate. We took that very seriously. We've got to do something. That's my take on it. I get it that a lot of people still won't wear a mask. You know what? I know people that don't wear a seatbelt.
Yeah.
You know what? They need to get caught.
I hope they don't die in an
I know
accident.
people that do other things, and maybe they're going to get caught someday. And you know,
Sometimes they do.
and sometimes they do. I hope that people will wear a mask. I've said that before, but this says this government believes you should wear a mask, and it will bring down. And you know, I really appreciate all the medical personnel that were here to speak. I gotta believe them. I gotta believe the people that are
Taking
in the
care of those
business, and
patients.
I'm worried for them.
Yeah.
I am worried for them, but whatever. You know what worry does? Nothing. So, all right. Nobody else wants to talk? These are great tonight. We have a motion on the floor. All those in favor? Oh, I'm sorry.
I do need to
You
read
wanna-
the change
you
into the
changed.
record
Go
for the
ahead.
clerk's benefit. So
Warning.
the change to incorporate a written warning into the resolution will be in Section 4, Paragraph 2, which will read, "The penalty for a violation of this emergency resolution is A, for a first offense, a written warning, B, for a second offense, a fine of $50, C, for a third offense, a fine of $125, and so forth." So we're just going to make that a new first bullet. And so the motion would be, I move to adopt resolution number R-20-116 in the form submitted into the record by the county attorney's office with the change read into the record by the county attorney's office.
That's my motion.
Seconder, do we need?
Seconder agrees with that.
Does the clerk have that?
Any other
All right,
comments
Thank
from
you.
board members or questions? All right. I'm going to go ahead and poll people just for the heck of it, so people like to know when they're listening who voted how. John, you had a,
Yes, ma'am. I turn Commissioner Johnson on. I apologize. 1 second.
okay, we will let Commissioner Johnson vote first.
Uh-oh.
Vote again.
Commissioner Johnson, go ahead. I'm
How
sorry.
do you vote? Yay or nay?
Okay. I'm absolutely voting nay. I think it's wrong on so many different levels, but I know it will pass. But I think it's a bad decision that we're making, a bad policy decision, but I vote nay.
Thank you. Commissioner Baugh?
Oh, I guess I am next. This commissioner votes nay.
Commissioner Bellman votes yay, as in yes.
Whitmore votes aye.
Misty?
Servia votes aye.
Trace votes nay.
Manak votes aye. Motion passes. Sure.
I'd like to make a motion that we do not proceed with an ordinance. I think the resolution will be fine. In the last meeting, we actually said to do the resolution now and then have the staff working on an ordinance that would come forward 10 days. I see no reason to have an ordinance. So I
Second.
make a motion that we do not proceed with an ordinance.
Second.
Can
All
I
right,
just,
we have a motion, a second. I'm going to ask Commissioner.
Betsy, Misty,
I'm going to ask Attorney Clegg to address this because he had discussed this earlier, so go ahead.
we have no objection to that from the county attorney's office. We'll come back to the client and ask you for permission if we feel like it's something we need to do from a legal standpoint.
Okay. All right, we have a motion and a second. Any comments?
did you, Misty?
No, no.
You raised your hand.
I don't think I need to speak because what I'm hearing is we're not going to do it now. Is that your motion? We're not going to do it now
You don't wanna do it
or
now.
ever?
Well, my motion
Priscilla's
is
is
we
ever.
would never do it ever, but I understand also that y'all can come make a motion whenever you want.
Anytime.
Yeah,
But,
so I will not be supporting that because I just don't think we have enough information today to make decisions forever.
Okay, so we have a motion not to bring forward an ordinance at this time?
Yeah, that's what you just said.
Is that what you said?
the way I understand it, at the last meeting, we said to do the resolution and an ordinance.
Right, so I have a
So,
question on that.
So I want to say is, I do not feel like, right at this time, all right, I will say, at this time, I do not
Okay.
think we need an ordinance.
All right, a motion not to bring forward an ordinance at this time.
But the way I
Do we have a
understand it-
second to that motion for discussion?
I seconded already.
Oh, yeah, I don't know why I'm looking
You
at
just
this.
can't hear me because I have my mask on.
Good
All
girl.
right, we have a motion not to bring an ordinance forward at this time. We have a second. Commissioner Bellamy, you had
Well,
a,
I guess my thought was, because we already had in our previous motion that we were going to do the resolution, then the ordinance. And so we're saying that we're gonna go away from that, or the reality of it is, we're gonna pause and see what's going on before we come back. Is that what the reality is?
that's what I heard from the attorney, if you'd like to reiterate that.
Yeah,
Mr.
Although
Clay.
I will have to ask if you put it that way, do I have the authority to make
That's
that
what my
motion?
question was.
Because
Well,
I
let's
was
ask
on
the
the
attorney.
prevailing side, so I.
The answer is yes. We take our direction from the board. And if the board wants to come back and hear from us before we initiate that process, the board's the client, that's fine. It's fine.
No, I
We would
think
have a
that-
responsibility to do that anyway, to keep you informed. Yes,
And that's
ma'am,
what
Yes.
you do.
Because she was on the prevailing side, does she have that right, Mr.
But
Brown?
it is not technically a motion to reconsider. It is not. I mean, if it were a motion to reconsider, that would be different. The
Language.
board can change the direction to its lawyers at any meeting, honestly. We work for you all, we represent you all, and if you say you want us to handle it differently, then we will.
Well, and what that means to the public that's listening, I think it's important that what this motion would say is we're going to stand by this resolution. We're not going to bring this up again to do an ordinance. The attorney's telling us the resolution is sound as passed, that we don't have to follow up with an ordinance, so there does not need to be additional public meetings, more discussion at this time. So it just clarifies what we said.
Madam Chair.
Last week.
If I could, what would drive us coming back is if we receive a lawsuit and we feel like it will strengthen our legal position to take the next step, then it will be our responsibility to come back and talk to you about that and say you need to do that. That's part of the job. And we're happy to do that. It's fine.
Okay, and I'm going to support this because I think it makes sense. You know, this is a temporary, hopefully a temporary action. We're going to have people in masks forever. So from my standpoint, that's the way I believe. This is going to be a week to week, just like our emergency ordinances. It's week to week. So I'll support this. Okay, any other comments?
We're slap happy.
All right. All those in favor of, well,
Yeah, you should
a
take.
public comment. I'm
call
going to
for
open this up for public comment. This is to not go forward with separately with an ordinance. Is there anybody who'd like to address the board on this? All right, nobody more on the phone? John?
If any callers would like to comment to the board, dial *9, and I'll see your hand raised. Any callers, dial *9. Commissioner, I'm not seeing anybody.
Okay. Close public comment on this motion. Commissioner Johnson, how do you vote?
Yay.
Commissioner Baugh?
Yeah, yes.
Commissioner Bellamy?
Yes.
Commissioner Whitmore?
We all agree on this one.
Right.
Aye.
Commissioner Serbia?
Aye.
Oh, she changed
Trace
her
says
mind.
aye.
And I vote aye as well. Okay, motion passes unanimously. Thank you. I just want to thank everyone. I think everyone did a great job today. Honestly, I think that the public did a great job.
Yep.
We heard from
I agree.
as many people as I think we possibly could have, or at least they all had an opportunity. So I just want to thank everyone for coming out and for speaking from their heart. I really believe everyone does that. So thank you. And without any further business, we are adjourned till tomorrow morning at 9 o'clock.
For about 12 hours or something.
My sweatshirt. They can steal it if they want.